right. We'll open up this meeting of the Yamhill County Board of Commissioners combined formal and informal session for November 19th of 2020. And we begin with a flag salute. And Commissioner Olson, can you lead us?
Somehow I thought you'd get
Right to left.
I pledge allegiance
To the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you. Little lag there. And then Commissioner Sterrett is joining us by video, so that's why there's just two of us here. But before we move through it, Commissioner Ken, do we need to do anything to approve Commissioner Sterrett meeting?
No, I believe under
Remote.
the emergency declaration, the
Perfect.
board had already approved the ability to participate electronically. If we wanted to use this time now to have a discussion before we get further into the agenda, I do think this might be an opportune time to talk about how we're going to conduct meetings. And
That sounds great. Commissioner, does that sound good to you?
Sounds good to me.
Commissioner?
Yes.
Okay, great. Go for it, Ken.
okay, so we did purchase licensing because we do recognize, I think Teams has been really effective for internal meetings, but we've learned that for hosting external meetings or doing public type meetings, we think Zoom is a much better platform for accomplishing that. IT, Shane and John Burns have been working on that. They obtained a license yesterday for the Board of Commissioners. And if the board, if there's consensus or a green light, what we'd like to do is get things set up, get it noticed, give sufficient time to get the notice out, but then start doing formal sessions virtually on Zoom.
It's the second, December 2nd. Would that be the first one? Is that the goal?
December 3rd.
3rd? Yeah.
That's
Okay.
what that's our target, is we would like to start doing it at that point. We're gonna do testing and get some other things in place. We wanna do some trial runs because we haven't done a full one. I know there's a lot of other jurisdictions that are doing their formal sessions. This is new for us. I just wanna make sure that to get things tested
Yeah.
and fully up and running, and I really want to do it on the 3rd because December 10th, we have land use hearings, 2 work sessions. December 10th is going to be a very intense,
Yes.
a lot of things on that agenda. So trying to make sure that we have all the bugs worked out before we start going into land use hearings and everything else that's scheduled for the 10th. So we're really trying to push the timeline and being really aggressive with that.
Yeah, thank you. Commissioners, do you have any comments or anything you'd like to add to
Well,
Ken's
I think
idea?
with the current challenges we're facing, and especially using Zoom where we can have both the participants and the audience, that I think that's the way we should go for a while.
Okay, sounds good. Commissioner Sterrett, do you have anything you'd like to add?
Yes, and I had asked that I be able to do this today by Zoom because, the new mandates require, whereas before we had positioned ourselves 6 feet apart and staff was very good about making that 6 feet apart and the mask part wasn't mandatory at that point. Now it is. And since I'm not willing to wear a mask for long periods of time, I asked for this. So I just think in the interest of a viable option for all, I think this might be the best way to go, and since we can do it, do it.
Yeah, I agree, Commissioner. I think that especially, I don't want to have a situation where we have to have, we choose to have one person remote and 2 people. I think it's better for us too, for our decision making, for all of us to be on one platform. So thank you. Well, and if you need any help, just let us know. If you need a trial run with one of us, I'm sure that we're all willing to help you with that.
That sounds great.
Okay.
And we'll get that moving forward. And again, Christian.
Well, just one other thing. I mean, if we're ready to talk about this, have we made a decision about whether or not there'll be a meeting on the 17th of December? Would now be a time to talk about that, or is that too far out? If the board's going to meet on Thursday, the 17th.
I believe that we're planning on it. Commissioner Sterrett, is that your
Yeah.
understanding?
Okay.
Yeah, it was my think that would be needed.
Yes.
Okay, great.
Okay.
Yeah, I
Okay.
think for December calendaring, it was gonna be the 3rd, the 10th, and the 17th.
Okay.
Yeah, I just don't think we had scheduled 25 things yet for it,
I
so.
just wasn't sure, given that close to Christmas, if that was going to be a potential session that might be in play, but that's fine. Plan
I
on
think the
that
way
date for now.
the holidays are falling.
Because Christmas is the 25th, that's the Friday.
Christmas is usually the
And
25th.
Christmas Eve is Thursday, which is a holiday.
Yep.
I think we'll have some questions for that week, and historically, we haven't done formal sessions between the Christmas and New Year holiday. So I think that's gonna be the week that's gonna be in question, because Thursday is a holiday for the county,
Mhm.
so
Right.
county will be closed in recognition of, or for Christmas Eve on the 20, sorry, I don't have a calendar in front of me. But we can-
24th is Christmas Eve and Thursday. Yeah. Well, I think that it might be, as we get closer in and we've got coronavirus relief fund, the CARES Act stuff, it might be worthwhile to at least consider meeting that. Harry, you know the calendar better than me. Is there, there wouldn't be another session. I mean, I guess if we did it like Tuesday following Christmas. I'm looking at you. I should be looking at both of you.
No, and we could do that because, I'd like to keep the options open for that, because I agree, much like today, historically, AOC. We don't have formal sessions, yet here we are. So I do think that there could be some business drivers or some year-end matters that are gonna require the board's attention that, then we may need to be flexible with that.
I think
So
it's
would we
absolutely.
be talking about, we wouldn't meet on the 24th, would we be talking about potentially meeting on the 31st?
Would that be the Tuesday?
We could,
No, 31st.
31st is the
Oh,
following Thursday,
Of course.
Because being, if we're gonna do them via Zoom anyway, that if we could notice the 31st is, put notice that it says, if required, notice it that way.
Yeah, I mean, I think Thursday, as long as staff has enough time to deal with things that we make decisions on before the end of the year, will there be time?
Yeah, because I do know that, I think we'll have time to kind of vet it as we start going through the month of December.
And Carrie? Yes.
If we're talking about, we better do it probably on the regular Tuesday, because they will, when accounting will be closing down that afternoon.
Yeah.
Oh, yeah, it needs to be a little bit different, I think.
It depends on what kind of business we have.
Yeah. So a Tuesday or the Thursday, I would be fine with doing
Yeah,
it that
20
Tuesday.
And that would be the 29th, or are we
29th.
talking the 22nd?
29th.
Yeah, I'm fine with the 29th too.
Commissioner Starrett, is there a day that's better for you in that week?
I'm having trouble navigating this. Can you hear me now?
Yes.
Yeah,
Yeah, I would be willing to be available whatever day works best for anybody.
Awesome. Thank you.
All right.
Great. Thank you, Christian, for bringing that up, even though we weren't there yet. All right. Well, we just went through our calendar session, as it were. I want to just make it clear that Commissioner Starrett and I were both on a call with the governor and her team on, Commissioner, what day was it? It was 2 days ago.
It was Tuesday.
And I realized that it was a very short notice, but I don't believe that we talked about anything that's coming before us. Do you, Commissioner?
To mention letters that have been going to the governor's office, and I might be asking for the board to consider signing those, but I don't think the substance of those letters was discussed.
That's right. That is one detail. And if we needed to, we probably could get minutes from it, I'm guessing. If you need them, I don't know. Okay. Are there any other meetings? Oh, are there any other meetings that we have coming up that Carrie needs to know about?
I don't have anything on my calendar.
Okay, great. And I apologize, Carrie, that I didn't get that one to you. I was thinking, okay, what is she going to talk about? Not, do I need to send this to Carrie?
Well, and I looked at, I'll look at Christian, on that, but a lot of times with those types of calls where, you know, if we know in advance, we try our best in an abundance of caution to get it on the calendar, but also recognizing that if you're getting a call, you know, impromptu from the governor's office that, hey, like commissioners to call in and participate, that doesn't necessarily give us the ability to notice that, nor, you know, I think we typically, like I said, we posted in an abundance of caution, but as far as the requirement, I think I'm looking at county council about the requirement for something like that, because you're not really seeking to deliberate, or, you know, you're basically attending something that's informational or an information exchange with the governor's office.
That's right. I mean, that's the way we've handled other sort of social gatherings or situations where there might simply be 2 or more commissioners in attendance. You're not necessarily convening a quorum, but it's always good to remember that if you find yourself in situations like that, if someone were to come up to you and ask you a question or want to discuss something that could be on an upcoming agenda or that you know is going to be on an upcoming agenda, the safest approach is to say that's not something that can be discussed right now. If it's something that's on an agenda, you can tell them it's going to be addressed at a future meeting. Please come and attend the meeting and ask questions and provide comment there. But yeah, there are often situations where there are going to be more than one or of the commissioners present. And as Ken said, if we know about it ahead of time, we'll try to put it on the joint calendar.
Yeah. And this was more than just an informational, it was a feedback base. So, but it's out there at least now. So Commissioner Sterritt, can you hear Christian when he speaks?
I can, thank you.
Okay, good. I just wanted to make sure. Okay, great. Then we will move on to public comment. And due to COVID-19 and physical distancing requirements, anyone wishing to submit general public comment or comments related to a specific agenda item may do so in written format via email at bocinfo@co.yamhill.or.us or by mail at 535 Northeast 5th Street, McMinnville, Oregon 97128. Any comments received prior to the meeting will be shared with the Board of Commissioners and submitted to the record. And we do have comments on one agenda item, but we don't have general public comment, correct? Okay, great. Thank you, Carolina. We move on to our work session now, which is item E, and we have none today. And we move on to item F, which are our department updates. And item FA is the Sheriff's Office update with Sheriff Tim Swenson. Welcome, Sheriff.
How's it going?
Good to see you.
Appreciate you guys taking me at the last moment. I apologize for not being able to be there last week, but I had another obligation and you guys had a full schedule and timing wasn't going to work out very good. Emergency manager.
Oh, Sheriff, just a second. Ken Huffer has something he wanted to interject.
Sorry to interrupt, Sheriff. I just wanted to, just, for the record on the public comment, I just wanted to clarify that there are specific agenda item comments, but then there was also a series of emails. There, it looks like it was an email petition or something like that, where there were comments. And it was submitted to the BOC folder, and in the subject line, it says public comment.
Oh,
And I
okay.
just want to acknowledge that we did get those emails in the BOC folder, and those will be added as part of the record.
Okay, perfect. Yeah, those like,
just wanted to
I think
know.
like last week, I think we had general public comment around health insurance increases. And Carolina was wise enough to not print off every one of them. So they weren't in the physical packet, but they'll be in the minutes and attached to the record.
Correct, and
Okay.
I just wanted to acknowledge that we did have that, just to make sure in there for clarity, in case there's questions for anybody watching the meeting, and has questions about those emails. They are part of the record as part of the public comment period.
Great, thank you. All right, Sheriff.
No, not a problem. You guys got to handle county business. I don't envy you. Just wanted to kick off the conversation with emergency manager, Sergeant Brian Young, is actually currently working with Washington County and Tualatin Valley Fire and Rescue on a after-action report workshop specific to the fires that we had in the north end of our county. I sent a copy of our own after action report to Ken a few days ago. So I'll let him distribute that to you guys as he sees fit. There are some tactical pieces that are in that report, so that's the reason why I didn't send it just to the entire report as a whole. But we do have a decent after action report. And with the workshop today, at the end of this, my plan is to have Sergeant Young put together kind of an additional update on a few things that are going on with EM, and then send that to Ken, and he can forward that on to you guys as well, so you can have a good update of where they're at. A couple key talking points I know you wanted to bring up was that the mitigation plan has been completed. And most of the cities, I think there was only one city that didn't complete the process, but they will be approving theirs as soon as well. The EOC upgrade grant project, we received an extension, given the timing and the inability to get certain things done. The state's been pretty lenient on that upgrade project. We've been able to readdress or realign some of the funds to deal with some other issues. So that continues to move forward without any issues. And then the one big thing that I'm sure you guys have heard a little bit about statewide is that the state is pushing for a statewide emergency notification system. And it sounds like they are moving forward with possibly using the Everbridge platform. They will be housing it in DAS within the state, and they just started the conversations about what that might look like. Most of the counties in the state that already have this system, which we would be included, there would be a way to have the conversation that we basically would manage it as we do today, still have the same control. There'd be probably a cost savings to us because it'd be paid for through the state. And at the end of the day, it's probably going to help us out a lot more than where we're at right now. And it saves us the money that we'd have to be paying for the system every year. So we'll see where that goes, but it's in the very early stages. And Sergeant Young is currently the acting president of the Oregon Emergency Managers Association. So he's pretty apprised of where they're at and at the table having those conversations. So as things move forward, we'll make sure we keep you guys posted of where we're at. But at the end of the day, regardless of what the state does, it will not change the service level that we have with Everbridge for our county. It's either going to be housed at the state or it's going to be housed locally. At the end of the day, it's just going to be a change of who's paying for it. So, any questions about that before I move on?
No, commissioners? That's good to hear. And I believe as a like a person who signed up, I got an email through the Everbridge that was like, hey, we're working on this and we're thinking about giving you more generalized updates. Is that still, I mean, I got that, but I was pretty sure it was just because I was in the notification system.
Yeah, so we are going to start using it a little bit more on the alerts side, because there was two different types of alerts that you could send out. The ones that happen right in the middle of an emergency. And then there's another side of it that Lincoln County used quite a bit. And they did that primarily because they had Everbridge for a much longer time frame than we had. They've used it for multiple different types of events that they've had down there at the coast. And so what they were doing was more of just a generic update to all people who are part of the system. It wasn't necessarily an emergency, hey, we're at a level 2 now and you need to evacuate. It was, hey, this is kind of in general the updates of where the fire is at, what the evacuation levels are at, where are the resources available to you, and they'd send those out periodically throughout the event. And so that's a conversation that came up in the after action report that they're going to continue to work on to use for all sorts of types of events that we have coming up. So they'll definitely allow for a better use of the system, and still allows us to maintain the emergency side of it, which means we still want to make sure that in an emergency, when we send something out, people are going to pay attention to it and understand that it's a priority.
The next question I have is the vision for the statewide system that also is an opt-in the way that ours is?
I think the vision is that it would be identical to what we're doing now. The only difference is that the state is going to negotiate the contract with Everbridge and the state will be paying for it.
Okay.
And so the benefit is that agencies or counties that don't have the ability to pay for a system like this get the benefit of having one. And then the counties like ourselves who currently have it, we get to continue to maintain it at the same level. We're just not paying for it every year.
Okay, great. Thanks.
Mr. Chair, just
Yes.
a couple comments on that. And thanks, Sheriff, for that information. I'm glad to see we have Brian in a position where he'll be very much the front and forward of that project moving forward. But I can tell you, I do have a concern about the state. And I see this as, even though we talk now and about they'll pay for it, they'll host it, but we want, nothing we do will change. Well, I think anybody that's been through the DMV debacle, the employment debacle, unemployment insurance debacle, I just have no confidence in the state being able to carry this out without impacting Yamhill County somehow. And my second question is, do you know the money for computer modernization that was given to the state? And I still think they're sitting on like $86 million. Is that one of the state plans on funding this from other projects that money was supposed to go from? And I don't know if Brian knows that or you know that, Sheriff.
Yeah, I'm not quite sure exactly where the state is planning on pulling the money for this. I know that this was a big push in the most recent fires that we had, that there was no statewide standard emergency notification system. So it became a priority from the state to do that. Where they're paying for it, I'm not quite sure. The one piece though that, Commissioner, that we have the same concern about is losing that local control, because as of right now, we have total control over our system. We have the ability to set it up, put the users in, monitor it, and do what we need to do. And some of the early conversations that they've had with the state is, for whatever reason, the state really doesn't want to have the control. They want the counties to maintain it at the same level they have right now. They just want to have a conduit to be able to just pay for the system statewide to make it available to everybody. And part of that, I think, a little bit of the reassurance that I had was originally it was going to be housed under the department through the OEM. They moved it out to a completely different division under the Department of Administrative Services, which tells me that they hear our concerns of who's going to be monitoring and controlling it, and that it needs to be more local control.
Okay, thanks, Sheriff.
Yeah, great. And Commissioner Sarrett.
Yes, Mr. Chair, and thank you, Sheriff. One of the conversations I had with Sergeant Young early on, a few months back when this was first discussed, was again, echoing what Commissioner Olson said about the no confidence in the state having any kind of administration duties, because we know that, like, if you look at the other departments that they manage, it doesn't typically engender confidence. But what he did say to me, which made me feel better about this, is that the Everbridge platform is the platform that will be going forward. So it's not like we're depending on any of the state interference in that platform. And I think that's where we can get a little measure of confidence.
No, yeah, Commissioner, I would agree that if they were advocating switching to a completely different vendor and different platform, I would advocate, no, we appreciate it. We're going to stay where we're at. The cost for the service is minor compared to the headache that we would have if we were having to transition to a new vendor through the state. But yeah, I agree that there's a lot of positives out of it. And of course, Sergeant Young will continue to be at the table, and he knows my position, at least and the county's position locally, that we need to be able to have some control over this. And it appears as of right now that that's the direction that the state's wanting to go, because there are a lot of counties across the state that currently have Everbridge, and they're echoing the same sentiments. Hey, we appreciate you paying for it, but we still want it to be status quo for where we're at. Just thank you very much for writing the check. And so I think that's in essence what it'll end up coming down to.
So Ken, I'm just going to interrupt for 1 minute. I happened to see an email that says, "Hey, we can't hear anything." So I just want to pause. Is it possible? Would it help to have like a microphone at the computer, or is it coming out of the speakers and then? Yeah. Okay. So their voices are going straight out. They're not coming through the room and back out.
No, it is coming through the room, and there is a central microphone that picks up everything in the room. You know, again, it's really challenging.
Sorry, there's a phone call.
You know, again, it's recognizing that we have challenges and being able to stream and have remote. We have a lot of different things that are all happening at once, and we're trying our best. Yeah, I knew that.
Okay. All right. Thank you, everybody. And I appreciate the heads up from the audience. Okay, Sheriff, back to you, and we're working on this. And just before you begin, so the audio, is there a separate audio file that people might be able to listen to later, or?
Yes,
Yeah.
Okay.
yes,
I just want to make sure that if people are missing things and they want to listen back, they can.
they can. And we'll have the audio recording that's going to be posted in addition to a video recording of the meeting. And then when we do transition to the virtual meetings, we won't necessarily have the same limitations because it'll be 100% virtual instead of doing a joint virtual in-person live stream, which we have 3 different systems at play here that are working. So
Yeah.
I recognize that there could be frustrations with it, and we're trying our best to navigate with the current pandemic and everything else, and with masks on and the multiple platforms that are in place. Again, we're trying our very best to keep our meetings open and available to where people can observe the meetings that are in the business that's being conducted.
Perfect. I want to make sure they got that. for the
Casey, I
record.
think
Yeah.
I've gotten some of the same comments you have
Okay.
via email just now, and I think it's very important for us and for staff to make sure that we have the microphones very close to you so you can pick up your sound and not 2 feet away. And I know Mary might want to well, Carrie's not over there to help her, but I think Commissioner Sterrett probably wants to either get a little bit closer to her microphone or.
I don't think she needs to. I think we need to increase the volume on the TVs because that's where the sound is coming through. I can hear them just fine on their, it's not on their end, it's the room, it's the limitations with the meeting room.
Yeah, totally.
Because one of the comments was it was almost impossible to hear Commissioner Sterrett. And yours too, Ken.
And it sounds like Carrie was thinking that it was actually the YouTube, going to YouTube rather than going from her to us.
Anyway, this is
Yeah.
I think this is a good test of what we want to do in the future.
That's right. Okay, with that, I just wanted to make sure that we got some of those technical things underway. Sheriff, back to you.
Okay, well, you give me a thumbs up or a thumbs down if I'm not talking loud enough. So as far as the rest of my update, I'm going to spend the rest of the time just kind of giving you a quick update of what's going on in our office. First things first, probably about a year ago, we started a strategic plan within our office where we involved all our stakeholders from line staff through supervisory staff, both divisions are jail controlled, to do basically a strategic plan for our office, talk about goals for the next 5 to 10 years, putting together kind of a vision or a mission statement for our office. And it really started moving forward, and then of course COVID kind of hit, and it kind of limited our ability to complete that. But we are going to be trying to figure out a way to complete the rest of that plan moving forward. And the reason why I bring it up is that in addition to that, what I'm going to be doing here within the next few months is basically an outside review of our management and supervisory structure. So back in 2018, we brought in a consulting firm to look at the operations of our jail facility, just to make sure that we're doing things the way we should, reviewing our current policies and procedures, and making sure that our staff are using the best practice policies and using them to their best ability. So similar to that, I'm looking at bringing in an outside entity to come in to review our command structure and our supervision within both divisions in our entire office. We're starting to get to the size within our office that I want to make sure that we've got the right people in the right place supervising our staff. I want to make sure that the communication lines are open the way they need to, and it's really going to be an opportunity for our line staff to kind of do an entire evaluation of our supervisors through the captains all the way up to myself. And the whole point of that is to kind of tie into our strategic plan to make sure that we are operating at our highest efficiency level within our office, that we have the right people doing the supervision that we need them to be doing, and that if there's some areas where we can improve through training, and if there's some areas where need to be improved by reallocating some of our internal resources or reassigning staff to different divisions, then that's something that will give me an opportunity to make that decision and not just do it based off of my own thought process, but kind of giving me an outsider's view of how things are going. So I anticipate that happening in the next couple months. It'll be a good process for our staff, and I'm looking forward to seeing what that has to bring. And I think it'll just further our ability to continue to provide the high quality service that we're doing to the citizens, because I think they expect us to continually put our own office in check, and this will be an opportunity for me to do that.
Long.
Are you still there, Sheriff?
On patrol vehicles. And so
You froze up there for a minute.
You froze up for a moment right as you right as you finished the strategic plan explanation.
Oh, okay. I said my next point was talking about patrol vehicles.
Okay.
So for years, I've worked with Rusty back when I was a sergeant, then all the way through as a captain, and of course now in my sheriff's position. We continue to have this conversation back and forth on what are we going to do for patrol vehicles for Yahoo County. A handful of times we've had our hands tied by the industry. As you were aware, we used to have 4 Crown Victorias. They came out and said, no, we're not going to do that anymore, so we were forced to switch to the Chargers. Then we started working our way through the Charger conversation, and we found that more and more we are in need of some sort of all-wheel drive package.
Okay.
And so we had transitioned for SUV, and because about a year ago,
You can. I don't know if you want.
frozen again.
No, you're
you're
good.
fine.
You're just on one screen now. That's all, or 2 of 3.
Oh, okay.
I'm listening. You're talking about all-wheel drive.
Yeah, so basically, about a year ago, Dodge shut down their production of Dodge Chargers. And we didn't have the ability to purchase any Chargers in 2020, this particular fiscal year. And we had to purchase the Dodge Durango. And so what we've seen now that Dodge has come back out with the option to purchase the all-wheel drive Charger, we have noticed that there's a significant benefit not only to our staff, but to the citizens that we serve with more of an SUV all-wheel drive package versus the Dodge Charger. So not to get too much into the details because my staff's kind of a final proposal and report with a whole bunch of specifics on the numbers and all the reasons as to why it's better. I just want to give you guys the heads up that I'm kind of having the conversations with the motor pool fleet manager. We always talk about the concept of needing to up our miles, our cents per mile for our replacement fund. We haven't done that in years. And so that's a conversation we're going to start having. And then we'll all be having the conversation as we move forward with some of these new purchases that are probably going to be more of an SUV package than the traditional Charger. But just to give you a heads up that to be prepared for some sort of formal proposal at some point to come across, but that won't be until sometime after the first of the year. Next, yes. Next thing would be, want to give you a quick update on our camera control panel upgrade there in the jail facility. The installation was complete as of November 1st. Part of the very end of the project is where we had integrated some of the FLIR cameras that we were able to purchase through the COVID CESF grant funding. Those have been installed, but there's still a little bit of software issues that they're trying to work out. And then we're also looking at adding those cameras to the service agreement that we currently have in place to make sure that we can keep those maintained. But those FLIR cameras, if you don't recall, will allow for 3 different entry points in the jail to be able to take the temperature of everybody coming in, and then it's monitored in our control room and gives us the ability to more efficiently allow people in and out of our facility on a daily basis and get them checked to make sure that they don't have running a temperature. The last big project that we're working on right now, and I hope to have the ability to move forward at some point, is I know we've been talking for years about the concept of body cameras for patrol staff. We have had a patrol sergeant put together a really detailed proposal for a body camera package that would include body cameras in our jail facility for all of our staff and our patrol facility. So all of our patrol folks would be issued a camera. It's in conjunction with our less lethal options that we carry, which are tasers. Those are end of life for that particular product. And the company that offers those are offering some significant cost savings for packaging the two together. There's a lot of benefits with buying new tasers with the body camera in conjunction, specifically on the patrol side. For a lot of the, for instance, if every time someone pulls a taser out of the holster, the camera automatically starts recording. A lot of safety features and benefits to it. But as we've said in the past, and as you've probably heard from this across the state, anytime the legislators are talking about mandating things of this nature with body cameras, they forget about the cost associated. And it is a very expensive venture. For example, the proposal that we're looking at for our county between the jail package, and then it's a yearly payment subscriber fee that you pay on top of that. One of the reasons why you haven't seen the formal proposal is because we are waiting for some funds to come in from some federal forfeiture that between the combination of those funds and a few other cost savings that we've had this year, I'd be pretty confident in being able to purchase and fund that entire program without having to take any additional allocations from the general fund. Any questions about that?
Commissioners? Commissioner Sterrett has a question. I can't see your hand, I apologize, but I could tell that you're raising it anyway. Go for it, Commissioner.
Thank you, Mr. Chair. Sheriff, question about the cost in terms of an unfunded mandate. At what point have you considered that perhaps that would kick in? I know we have a percentage we have to go by before we can consider this an unfunded mandate and require the state to pay. And maybe that's a canned question.
Well, I can tell you from right now, one of the reasons why the state has not pushed that issue, I think, is primarily because of those unfunded mandates. The county of our size, I don't know if we've reached that threshold, but when you're looking at like a Clackamas County, for the same
Sheriff, we've lost you again. Okay,
I'm
yeah,
back. I think
you're
I
back.
froze. So what I was saying is, as far as the unfunded mandate, I don't know if we would meet that threshold. I know that some of the other counties like Clackamas, their first year option would be closer to $1 million. So as of right now, the state has not pushed that heavily. Every year that they bring it up, we have been able to actively push back. But what a lot of entities are trying to do now is it's the time seems to be the right time for us to start moving towards that. I know that in talking with Christian, there's multiple times where anytime we have the ability from a liability standpoint to have video footage of the incidents that occurred helps us out tremendously when any time that there's a complaint or any type of tort claims that are thrown at us. And we just have never had that capability or that technology. And if it wasn't for some significant forfeiture funds coming into our budget that might give me the opportunity to put that towards this, I think we would still having to sit here and have the conversation of preparing for this 3-4 years down the road, because it is a very costly venture. But at the end of the day, within our existing budget, if we can get over the initial cost, I believe that moving forward, the maintenance of that moving forward is a lot easier for us to accommodate than having to pay out that large dollar amount every year, if that makes sense.
Commissioner, go again. I was going to ask you if you want to follow up. So Commissioner Sayre is going to ask a follow up, I think.
Thank you, Chair.
Yes.
Sure, a question about that regarding the insurance liability piece. I know that we're looking to basically convince or let CIS know that we really have stepped up our game. Would there be any, perhaps any advantage having these cameras in terms of a reduction in our premium?
That's a good question. I can tell you that when I've talked to them before, because that was one of their recommendations when they did their jail review a couple years ago and kind of put our county on that probation, was they recommended getting body cameras for our jail staff. When we tell them that we're looking at doing that, their options, they had some sort of grant fund available that at the end of the day was going to not really benefit our office for financially, because it's not the system that we're needing to go with. So I do know that we communicate with them on a regular basis. I think it would probably be worth a continued conversation between Ken and Christian on specifically for our jail liability, and then also with the patrol side, and to see if that is going to assist in those fees moving forward.
And Ken, do you want to add anything?
Well, and I'll just, the part that I would add is, while I don't believe that implementing something like this would necessarily have a direct cost savings associated to our general liability insurance, but if this were to, as a mitigation measure or a way to lessen the number of claims or the types of, it could have a positive experience as far as our experience rating would go, which then could in turn result in some cost savings in long term with our insurance portfolio. So more than likely, the short answer would be is just because we implement something isn't necessarily going to result in a direct benefit in reducing our costs associated to our general liability. But if something like this were to curtail or help with our experience and outcomes on any future claims that could come up, then that experience, could result in cost savings long term.
Yeah. All right, great. Thank you. Good questions, Commissioner Sayre. Sure.
And yeah, so I think the only other thing I would say real quick, just to give you a quick update, and then if you have any questions, feel free to ask me, is, for years I've been doing a lot of work at the state level and then at the national level with this inmate exclusion, where the Medicaid and Medicare funding gets cut off as soon as they get brought into our facility. We had worked at a national level with trying to get some procedures put together. The proposed budget was supposed to go through the federal government. Last year was going to give us a 6-month window of time. At the moment the AIC came into custody, they would be able to remain pretrial status for 6 months and still have coverage. Obviously with COVID and a bunch of CARES funding stuff, that piece just kind of got put to the wayside. But as early as just the other day, yesterday actually, I received an email from AOC, the Legislative Affairs Manager, and she is trying to put together a meeting with the AOC Health and Human Services Steering Committee and a representative, Leif, out of the southern part of the state to start a conversation locally to see if there's a way to get the state legislators to put some sort of document together to send to the federal government, urging them to move on this piece of legislation so that we can get some relief locally. I think it's a good move. I think it's a good time for us to be having this conversation. And as I've said before, to this day, I still don't understand how someone who comes in as a pretrial that's got veterans benefits or some sort of Medicare benefits and has been covered every day up until today, that all that goes away, and now that is the sole responsibility of my general fund dollars. So my hope is that with this meeting, we'll be able to get that letter pushed off to the federal government, and they can move on that and at least give us a 6-month window, which will give us a huge cost savings within our facility.
Sheriff, this is Casey. So my question on that is, I'm very supportive of this. The one thing I'm kind of struggling to see is how where the cost savings come from, because we're still going to have our contract, medical provider, correct?
Yes. So how it works is that right now, majority of our pretrial population who's under our Medicare or Medicaid coverage, the WellPath nursing program that we have within our facility can in essence bill back that service to Medicare and Medicaid for the expense of the treatment. We can bill the prescription meds through them, the in custody office visits that they have to go to outside doctor's appointments and all those things that are typically being paid for under our WellPath contract through our agreement. Those are all things that can be billed back to Medicare and Medicaid. And so where the cost savings comes into play is that the service that we're providing to those inmates, we will no longer have to pay for out of pocket, and a good portion of that contract can be billed back to Medicare and Medicaid, which saves us money in our facility, and we can use that money towards other things.
Right. So essentially your contract, I mean, the challenging thing is that, are you saying that your contract is going to have a lower cost then? I mean,
Well, I think
I'm just really curious about the mechanism of this. Yeah.
Because right now, we're not able to bill towards Medicaid. Correct, Sheriff? And so
That is correct. So
all these medical services and what we're paying for under the medical contract and everything associated with that, it's general fund. It's coming straight out of the jail budget. If we were to have this, then we would be able to bill for those, for those services against the insurance. And so we're not spending general fund money on these treatments.
Right, but we do. I mean, I understand the mechanism of it. I just, we're going to have a contract still, no matter what, with this provider. So presumably, then the contract is going to be lower because we're not doing the billing back to Medicare, Medicaid. The contractor is. I just want to make sure that this isn't just like a way for them to profit off of this without the county experiencing some benefit.
Yeah, so I mean, how it's actually going to look in the future, it'll be something that we'll still have to detail. How I relate this is similar to our Aramark contract and the food service we provide to the juveniles.
Mm-hmm.
And then we get a reimbursement back on a percentage from the state for the meals that we're providing to juveniles based off of a certain criteria. and that money then comes back into our fund and it offsets that expense. And so what we'll see is that WellPath has already got a mechanism to assist in the billing, and they've already indicated through their management that they would be willing to assist us in filing those type of claims, and then that money then would be coming back to us. So we would still be paying WellPath for their service, and money back, and so we'd be getting revenue back. And so at the end of the day, the contract may still be a large dollar amount, but we're bringing in, extra dollars back into our fund to offset it.
Okay, great. Thanks for explaining the mechanism of it. Commissioner Starrett.
Thank you, Chair. Sheriff, I know that this has been something that our Oregon legislators have been working on for years, as long as I can remember. I'm wondering how we're enlisting NACO in this in terms of more of a national voice.
Yeah, so the task force that I was working on for this piece was a joint task force between NACO and NSA, and so the National Sheriff's Association. And so the white paper that we presented to them was at the NACO conference last year, and it was forwarded on to the federal government, to the President Trump's office. He's actually the one who built in the 6-month extension for us into that budget. Since then, we've had a couple senators from the United States, one from Massachusetts, and of course Oregon, Berkeley, that had put together some legislative concepts to basically eliminate the pretrial section out of that Social Security Act that excludes them from getting these. And that legislative concept has also been stalled in the process. And so I think having the state now willing to have this conversation to urge the federal government through this piece, I think is a good step. The piece that the state has always been willing to offer, we just haven't been able to make it happen, is for us to just work our own little pilot program internally in the state to show that we can save the taxpayers money by doing this. But that's always been a big hurdle. It's a political battle locally to do that. But from the federal side, it's across the table. Both sides see this as an issue and they want to fix it. And it's just a matter of which way are they going to do it? Are they going to build it into an existing budget, or are they actually going to change the legislation?
Great, thank you. Commissioner, do you want to have any follow-up? But it was a great question, thank you.
Thank you, Sheriff. Thank you, Mr. Chair.
No
Commissioner-
follow-up from me, Mr. Chair.
Okay. All right, Sheriff, thank you.
Okay, so that's all I've got. Is there anything else you guys have that you need to talk about, or any questions?
Commissioner Starrett.
Thank you, Chair. Sheriff, I wanted to ask you if you could just address for us the Governor Brown's freeze and law enforcement's, the request that she has that law enforcement enforce the 6-person limit in home gatherings. Could you talk about your sentiment around that and what your law enforcement philosophy is?
Yeah, no, I appreciate that. Yeah, so on Monday, we had a conference call with executives from OSSA and OACP, which is the Chiefs of Police Association, and then the superintendent from state police. We knew that her direction was basically going to be, we're just going to have OSP talk to all the local law enforcement. And it was overwhelming response from across the state between the sheriffs and the chiefs that although we appreciate her desire to direct the state police to just tell us to go out and enforce this, that we just don't have the time, the energy, or the staffing to respond to these types of calls. And our position is going to continue to be, we need to educate our citizens, we need to ask for voluntary compliance. We're going to be directing people to OSHA and all those agencies that we've been doing from day one. But when it comes to Thanksgiving, which is, I believe, where we're going to have the big issue, is this is going to be a very similar situation as to what happens on the 4th of July. And on the 4th of July, there are thousands of citizens that decide to launch off mortars and all sorts of illegal fireworks in Yahoo County. And our staff are bombarded with phone calls from all over the county, and they have to prioritize given all of the other severities of issues that are going on at that time. And the only time that we respond to these fireworks complaints is if it's an egregious situation, such as they're shooting mortars off at each other, they're shooting Roman candles at cars that are passing by. So when it comes to this piece, although we appreciate the governor's position that she's in, her desire to limit social gatherings to a piece where we show a change in this curve. I just don't have the ability to send my staff out to every single call because a citizen says they see 6 cars parked at a house and they think there's 10 people in the house. There's just too much legal hurdles for us to get through, for us to ever get to an enforcement. And so I basically told my staff, they need to just prioritize it like they have been. There's no expectation that they respond to these calls. And if it's an egregious situation, there's a disturbance, there's a fight, we're gonna respond to it like we do always. And at the end of the day, we're just gonna have to use our discretion when it comes to enforcement.
Thank you.
All right, thanks, Sheriff, for clarifying that.
No
Okay.
questions.
Other comments or questions for the sheriff? All right, great. Thank you very much for the update. Safe and safe out there.
Thank you. I'm gonna go ahead and check off, and I'll let Lindsay give you all the good news on COVID.
All right, sometime we need to do a jail tour too. Welcome, Director Manfred. Or yes, welcome.
Hello, thank you. Thank you, Sheriff. I'm delighted to provide all the positive information about COVID today. So normally with our updates, I don't always have handouts, but I did prepare some handouts, largely because I wanted you to be able to see some of our most recent data, and I just wanted to check. Did those get to you?
No,
I can also share my screen. That's easiest.
why don't you share your screen with
Yeah,
me?
if you can do that, that'd be great.
I'd be happy to. Let me just get it pulled up here.
And we all received an email this morning from Leo Horner from the governor's office about hospital capacity too. So I'm sure that you have that same information.
Yes. Okay. All right, my screen should be showing, you should see a slide that says HHS COVID-19 update.
Yes.
Excellent. Okay. So I'm going to walk through some of our most recent data, and then we'll make sure that we have a chance to talk about any questions you might have. I have a few other non-COVID related HHS updates that I'll also share with you.
Director Manfred, can you make it view mode or whatever it's called? Is that what? Yeah.
Start slideshow.
Start slideshow.
Sure.
That way it's just bigger for the
Bigger
for the eyes.
How's that?
I almost said that, but
That's better.
yeah,
Better.
that's great. Thank you.
Okay. So I'm going to start with just a snapshot here. And this is data that's readily available on the OHA's web page. But I think it does a nice job of really showing what's occurred over the course of the last month, really. Yeah. So you're looking at 2-week increments here, and you can see our case counts, the cases per 100,000, and the test positivity rate, all quite honestly skyrocketing. So, just in the course of these short weeks, starting with October 18th, we've seen our cases per 100,000 go from 96.2 to 167.5 to our latest data poll that was pulled on 11/14 of 287.8 cases per 100,000. You can also see the corresponding test positivity rate increasing, going from 4.9 to 8.8, and then with the most recent one being 12.1%. So this is just a high level, big picture, and then I'll go down and drill into some of this a bit more. And please feel free to jump in if you have questions throughout too.
And Commissioner Starrett, I won't be able to see, oh, sorry, Commissioner Starrett, I won't be able to see you very well if you have a question, so make sure you raise your virtual hand too. Okay, sorry, Director.
No, absolutely. So this is our case counts over time. So you can see our first case back in March, and you can see us going, just throughout the course of the event. You can see here around early August where we had this initial spike. That is really when it prompted us to begin doing a number of temp hires. We really had to transition from having staff being able to maintain the workload of COVID-19 in addition to all of the other things that they are required to do in their public health role, and just recognize that we needed additional staff. And so we have brought on additional staff, and they have been a tremendous help and tremendous support to our teams to be able to do our timely and thorough case investigation as well as contact tracing. It's also allowed a number of our staff to be able to do other types of COVID-related work. A ton of our work is related to providing guidance to our business community, to general community members, to pretty much every sector you could imagine who has questions around interpreting the OHA's guidance, or has their own scenarios as business organizations, or even just with families around situations that are occurring, and they need guidance around what they should do in terms of next steps, quarantine, isolation, all of those things. So we have this spike, and that was definitely a trying time for our teams, and then we saw it begin to diminish, and we were all feeling pretty good around early September. And then you can see we've been taking some pretty dramatic increases since then. The highest daily count that we had was 45 cases a couple of weeks ago. We haven't hit that again, although we are continuing to see these case counts usually between 20 and 30-ish per day for our team to follow up on. Now, Oregon Health Authority, in relation to the surge of cases throughout the state, has put together surge guidance related to prioritizing case investigation based on those positive lab results for specific populations and individuals that we know are at highest risk. So things at the top of the list are anyone who lives or works in a long-term care facility, people who are over 65, food processing and manufacturing plants where we know the risk of spread is quite high. And so they've got a list that they put together of how to prioritize your cases if you're not able to get through all the cases in the way that we want to in that timely fashion. Yamhill County has not had to implement that surge guidance at this point. Many counties have throughout the state just because of capacity. So at this moment in time, we have not had to do that, but certainly, we have that ability to do so if we find ourselves in a position where we need to. And I very much hope we don't, but it's nice to know that that's there, and our staff have been trained on how to do that if they need to. This next graph really shows some emergency department utilization. We didn't do it all the way back to the course of the event, otherwise that would just be an extremely large, busy graph. But we did pull it from August. And what you're looking at here is we're assessing our emergency department utilization that's happening each day based on what we saw from last year's emergency department utilization for people going in with respiratory, flu-like, COVID-like symptoms, right? We didn't have COVID last year at this time, and so we're using our data around flu-like symptoms, so people going into the emergency department with flu-like symptoms, to give us a baseline of what sort of respiratory expectations we should have, so that we can then track to understand if we're seeing more than we typically do at this given point in the year. And as you can see, the blue dots here are normal data that tells us that we're looking at that. It's similar to what it was last year. And then we've got the yellow dots, and you can see there's a whole lot of yellow dots over here, means that we're seeing an increase in emergency department utilization. The red dots, there's a couple here, indicate that we're seeing significant increase over what we had last year. This is data that we have, that we review and analyze every day, and helps us understand what is happening with our emergency departments. So a real-time example of how we use this, of course, looking at it to see what's happening. And when I see little blips on the radar, it's one thing, but when I begin seeing trends like you're seeing here at the end, where we're seeing a lot of things above typical, that signals me to start having more in-depth conversations with our hospital partners to make sure that things are going okay with them, and see if there's any supports that they need, or if there's just anything that we need to be aware of. So that's status of what our emergency department utilization looks like at this moment in time.
I have a question, if I could.
Of course.
Please.
Thank you. A couple of questions. So last year, 2019, was that in terms of the last couple of years, let's say comparing it to influenza-like illnesses to 2017, 2018, how would you compare the severity of last year's flu or ED utilization or hospitalization rates, 2019 compared to like 17 and 18, which I understand were pretty significant flu years?
Great question. I don't have that data off the top of my head, but it is data that I can pull, and I'd be happy to if you'd like me to.
Okay, I was just wondering what the comparison was, because I know that was a particularly difficult year for ED and hospitalizations, and was wondering about that. And also, do we have any data about when there is someone presents to the ED with a respiratory-like illness, if there is, when I say founded, I would like, just think in terms of, is this where you've got a positive as a result, or whether this is maybe somebody who's just overly concerned about a respiratory ailment?
That's not any data that we have at public health. It could potentially be data that the CCO or Medicaid members or the hospitals themselves track around what they would consider appropriate utilization of emergency department. So certainly that would be something that they may have, but it's not something that's tracked in public health.
Because I know that we've had concerns through the CCO that we've really tried to manage our inappropriate or just keep our numbers down of ED utilization. And I'm just wondering if perhaps there's a level of hyper awareness of symptoms that people are presenting that they normally would not go to the ED.
Yeah, it's a great question. And I don't, I certainly can't speak directly to that, although I can share that. I'm going to go back a slide here. If you look at the emergency department utilization throughout the course of the entire event, we're not seeing this amount of data warning signals in terms of the yellow dots, so to speak. So if I were to go back, and this is again data that I'd be happy to share with you, back further months, there are a handful of those little blips, but not nearly to this extent or for this prolonged period of time.
Thank you.
You're welcome. So this is a pie chart that I've shared with you all before, but this is really looking at the cumulative breakdown. So again, looking back over the course of the entire event of how this is broken down for us. So it's looking at, in the blue here, this is our sporadic spread over the course of the entire event. If we add all of that up, we've got 25.4% cumulative sporadic spread, meaning we're not able to link those cases to any known source or other person who has COVID-19. So those are truly those cases we don't know where that individual may have been exposed. The goal, the benchmark set by the Oregon Health Authority has been 30%. So you can see over the course of the event, we are under that 30%. Although we've had definitely moments where that's been higher than others, and this is something that the state has been watching for, the watch list, as I know you're aware. The majority of our cases are here in this kind of yellow gold color here with 32.2%. Those are outbreaks. Outbreaks are defined essentially by having two known cases linked to one event or place. Or in some cases, the state has modified the definition of an outbreak to being a single person if it's in a place like a long-term care facility. So you can see that makes up the vast majority of that. I am working with our data team as well as the Oregon Health Authority and some other public health jurisdictions to understand our outbreak data better. And so at a point in the future, I really hope that I will be able to share more detailed information with you around our outbreaks, sort of looking at those outbreaks through the various categories in which they occur, meaning types of settings and things like that. So it's my hope that I'll be able to share more about that with you very soon. And then the gray makes up another good sized chunk, the 28.5%. Those are households. We know that it spreads quite easily in households, so it's not unusual or surprising by any means to see that really, when one person in the household is ill, it leads to other people in that household being ill. We do provide lots of guidance around how to best isolate an individual in a household whenever we have a case. And in some circumstances, depending on the situation, we may actually relocate an individual into something like a hotel or a motel to keep them isolated. Largely that's done when we have other individuals living in that household where we can feel confident that likely there's a possibility at least that they haven't already been exposed, and we want to minimize any future exposures for people that have fit those categories of being very immune compromised or having other types of challenges that would make their prognosis if they were to contract COVID-19 very, very poor. And so we have mechanisms in place to be able to do that when we need to. Are there any questions on this slide before I move forward?
Questions? Okay, thank you.
So this is a breakdown, and I know this is probably small, hopefully you can see this. This is a breakdown of our race and ethnicity data. I know that the state has put a lot of emphasis on the disproportionate number of cases that we're seeing in people of color. And we're not immune to that here in Yamhill County. So this chart really depicts what we're seeing locally. So here, the first column, you can see the race and ethnicity. You can see the total number of cases next to that. We broke the cases down by per 10,000, just to make the numbers a little easier to digest versus having the cases per 100,000 like we usually have been doing. You can see the complete number of tests, and then the test for 10,000. And I think some important things to note here is that there are certain populations of people within our community that are based on this data disproportionately affected by COVID-19. And I think there's a lot of reasons why that is. One that I'm going to call out specifically here is you can see that our Hispanic or Latino population makes up 16.2% of our total population in Yamhill County, but they are actually making up 41% of our total cases. So that has really prompted us to do a number of things. We're working as closely as we possibly can with community-based organizations who do outreach and education to these populations of people, wanting to provide culturally appropriate and linguistically appropriate information to them so that they know the best ways to protect themselves. We've worked closely with Virginia Garcia to do a number of targeted testing events as well as testing events for the community. As I know you have likely seen, they've been doing a lot of wonderful community testing for all members of our community as well.
And Director, I also note that, based upon my really crude math, it's almost a 20% test positivity rate cumulative for Hispanic or Latino.
Correct.
Questions, Commissioners?
No question.
Yes. I have a
Commissioner
question.
Sarah, yeah.
Thanks, Mr. Chair. Lindsay, thank you for this. This has been one of those conundrums where it's like, why is this happening and how do we mitigate this, maybe get ahead of it? I believe we've had a conversation about this in the past, and it seems to be sort of a really basic, inexpensive, prophylactic way of addressing this, and that is that virtually everybody who presents with COVID has a vitamin D deficiency. And that seems to be universal. It seems to be universal in the population. But if we look at absorption rates for vitamin D, and we see that the more melanin in the skin makes it more difficult to absorb vitamin D, that perhaps that's just one of the things we're overlooking. Has that been a public health initiative or even a question that we've asked just to get ahead of why we're seeing the differences in the race disparities?
So I think that could potentially be one of many factors. I think there's a lot of factors that play into what we're seeing our data show us around the disparities. Specifically around vitamin D, I haven't seen anything coming, from the Oregon Health Authority around that specifically. Although just general wellness, including nutritious food and vitamin supplementation, has been something you have. If you're following the Facebook page of Public Health, you see that we push out information around that. And in my current Viewpoints article, I even indicate that it's worthwhile to check in with your provider about potential supplementation. I think the thing about supplementation that's critical and important is I don't believe that there's much evidence that shows you can supplement your way out of a completely unhealthy lifestyle. And so I think that that's important to note anytime you're thinking about supplementation. I also think that while we always need to be looking at all sorts of causes, including the one the potential cause that you mentioned, that it's worth noting that there are a number of other things that we believe strongly are playing into this sort of data that we're seeing and these health disparities that we're seeing, including things like workforce challenges, where we know that folks that are in the lower socioeconomic status have a harder time leaving work. They don't have paid time off. We have reports of employers firing employees because they tested positive, won't let them come back. We have people who are scared to tell their employers, and then if you're working in a facility that has close quarters, that leads to spread clearly. And I think the other thing is living conditions, having lots of people in a small confined space is also not conducive to slowing the spread by any means. I also think that it's been challenging to reach populations in culturally and linguistically available and appropriate ways, which is why we've enlisted and wanted to get support from those community-based organizations to help us do that in a way that it can be understood and heard. I am really proud of our public health team for immediately thinking about these things, even before we saw a lot of translated materials, health and safety messaging materials available to us. We made it one of our priorities and top goals that we would not be pushing out information in English only, and so immediately pulled one of our staff who began doing translation for all of our social media posts, as well as anything that we were putting on the website or distributing via flyers. We also went around initially, and we're posting things on Food Market and Food Mart windows and things like that, just trying to get information out to people who may not have access to electronics and social media and things like that. So I think, and one other, Patricia, you and I both have a big passion for nutrition and things of that nature, so I always appreciate having these kind of dialogue with you. I think one of the other things around the vitamin D is that I think largely, particularly in our area, the vast majority of people seem to be deficient in vitamin C from a lot of research has indicated. And so, I think that just needs to come in play as we're talking about people with COVID-19 being deficient in vitamin D. Is that representative of those getting COVID-19, or is that representative of the larger population itself just being undernourished, sadly? I mean, we do live in a society where people are undernourished for sure.
Thank you so much.
Absolutely.
Great. Thank you for those questions and comments.
I talked a little about the surge guidance. A couple other things I want to note just around COVID. We are doing a tremendous amount of work right now related to vaccine and being prepared prepared for vaccine, working very closely with all of our healthcare partners as well as other community partners that we're hoping will assure that the plan that we have drafted is going to meet the needs of some specific populations, including the Latinx population, including food supply chain employees that we know are critical to all of our survival. We all need food. Manufacturers and food processing plants where we know that there's lots of close quarters and things can spread easily. And then to our intellectual and developmental disability population, wanting to assure that our plan addresses and meets the needs of those individuals. We're working essentially through sort of a phased plan, knowing that initially when the vaccine becomes available, it will be available only to high-risk healthcare workers. And so making sure that those people in those facilities, such as our hospitals, are planned and prepped and ready to go when that arrives. And then as more vaccine becomes available, we will be moving to getting that distributed and getting that in the hands of all of our local healthcare providers, like primary care providers, working to vaccinate the high-risk population. And then slowly, again, as more vaccine becomes available, beginning to do more of the community-based pods, the points of dispensions, where community members can come and get vaccine if they elect to. So we're working to closely with our county emergency management. We're working with our medical reserve corps. We are continuing to do some temporary hires for nurses who can be vaccinators. We have a pool of volunteers outside of the medical reserve corps that we're trying to get in that are all interested in supporting this effort. It's not an easy task. It's got dozens of moving parts, but we are all working really closely in terms of the community to make sure we're all ready to hit go as soon as that vaccine arrives. The last thing that I just want to mention around COVID is we are approaching this fiscal cliff that ends on December 30th. And we literally have no more funding to be able to support the additional COVID efforts that have come to us largely through CARES Act funding. Lots of conversations happening at the state. I'm participating in some work groups around how best we will manage and what we will do once the funding stream goes away if there's not either a temporary or more permanent fix in the near future. But it is something that is definitely high on my radar of concerns, and I wanted to put it out there to you all too, so that you understood the critical nature of what those CARES Act funds have allowed us to do in terms of staffing and purchase of personal protective equipment and all things of that nature. So any other COVID questions at this point?
I think Director Manfred, this is Casey, or this is Commissioner Kula, whatever, my main question for you at this point is, how can the commissioners help you, public health and the county with this? With COVID in general, I see the opportunity for lobbying on the funding, but specifically from your perspective.
Certainly, the lobbying around the funding and just assuring this stays high on the radar as far as what's going to happen over the coming weeks is critical. And I think the other thing is about messaging and really listening to the sheriff and talking about enforcement and things like that, and how we really just have to rely on people making good decisions and people being safe and just promoting that and reminding people that so much of this is in their control, is within their power to help bring this surge down, to give our hospitals some breathing room, give them some capacity where staffing is challenging right now. We're seeing staffing challenges across the state, and that's happening in Yahoo County too. So we saw that surge happen in August, and we brought it down, right? And we can do that again. But it's going to take the work of the community. It's going to take the people who live in Yahoo County to make decisions that they are going to be part of driving these numbers down and keeping our hospitals, staffed and available for all things. But it's really going to take them. And so I think we really just need to be really doing everything that we can to get that message out there.
Okay, thanks. And Commissioner Sterrett has a question.
Thank you, Chair. Lindsay, a question, I want to go back to the hospitalizations compared to August. Can you refresh my memory? I don't have that in front of me. In terms of hospitalizations, are we at the highest we've ever been, or were we higher at one point? Because we have, what, 7 right now?
Yeah, we have had, locally, we've had a higher number of individuals hospitalized. One important thing to note about our hospitalization numbers is that when you're seeing the number of reports and the number of people hospitalized in Yamhill County, those are Yamhill County community members who live in Yamhill County. It doesn't necessarily reflect the hospitalization happening in one of our 2 local hospitals. Oftentimes they are transferred to other facilities.
Oh, yeah, I understand that. No, I know it's OHSU and St. Vincent's, I understand. So I'm just talking about the numbers from Yamhill County, because just wondering about that. We have had higher numbers in August.
We did, yes.
Okay, thanks.
So the follow-up on that one is people hospitalized here or Yamhill County residents hospitalized elsewhere. I just kind of get a sense of, is your answer to Commissioner Sterrett referencing the activity and the work in hospitals in our county or in general?
You say that?
Yeah. So your answer to Commissioner Sterrett suggested that in August, our hospitals had more COVID activity, but really the number of hospitalized people that you list right now versus August is in other people's hospitals, as it were, not in our particular locale. And I think the question was around, how are our hospitals doing? Or is that not even really the question? Is it the regional system that's more the question?
So I think anytime that I'm talking about our numbers of people hospitalized, I'm talking about individuals who are community members that may be hospitalized in other places or may be hospitalized in the Yamhill County hospital. Just depends on the circumstances. I think your point about whether it's, talking about our hospitals or if we're talking about regional hospitals is a good one. I think both are critical and both are important. We certainly can't ignore what's happening at a regional level, because that certainly does impact us and our ability to function, for sure. So we need to be paying attention to both is what I would say. And I think that we have had challenges with, just the entire state has messaged out that there have been challenges with staffing. And so, I think if there's any direct questions around our local hospitals and their own capacity, that would be best directed to them. They understand and know what's happening with them far better than I do, for sure. But like I said, the numbers that we're reporting are people, not necessarily tied to our local hospitals.
Okay, yeah, thank you. And Commissioner Sterrett has a comment.
One more question. Question related to, again, going back to hospital capacity and staff. Now, I know there were staff furloughs during the time that the hospitals were not doing any non-emergent procedures or any kind of routine care. There have been furloughs. Have those people been brought back to increase the staff capacity? Do you know?
I don't know. That's a great question, but I think our hospitals would be better able to answer that than me, for sure.
Thank you.
Other questions? Commissioner Olson, do you have any?
No, I'll just read the email or the document, the hospital information document put out by Leah Horner, the governor's assistant, regarding some of the hospital regions that Region 2, which is Yamhill, Polk, Lane, Marion, Benton, Lynn, and Region 7, which is the Central Oregon, Klamath, Harney, and Lake, and Region 9, which is going to report high census, but manageable at this time, with the exception of R9 transfer noted below. So.
Yeah, and it notes, the same report notes that Region 1, which includes the Portland metro area, has had significant constraints on hospital capacity over the past week. There you go. It's live updates. Director Manfred, is there anything else that you would like to share with us at this point?
Real quick.
Okay, great.
Some very quick updates. I know we're short on time. Just the HHS continues to go through the transition with the CCO around the Medicaid plan oversight. So that's been a slow but very well thought out process, and that continues to happen. A new CCO line, service line is coming in and will be provided by Yahoo County Intensive In-Home Behavioral Health Treatment. It's really for the highest level of acuity for youth that are able to get, it's really providing hopefully that step down before they would have to go to some sort of acute bed facility. There's still lots of questions about how this will both look, how it will be implemented, as well as how it will be funded, but it's definitely high on the radar as far as things that are happening and conversations that are happening at the state level with CCOs and community mental health programs. We continue to expand and grow our medication-assisted treatment program. Our team has been doing amazing work, even during COVID, getting those individuals who have substance use disorders related to opioids in and on medication that really helps stabilize them and move into that sort of recovery phase. I want to highlight the fact that our veterans team received some really positive media recognition for their efforts around really honoring and acknowledging our veterans around Veterans Day, and we're very proud of them. And then, of course, Measure 110, I know this came up with the sheriff as well. We're definitely watching this closely for two main reasons. One, watching to understand how this may impact services. There is some concern that we may see the level of a number of people seeking treatment may decrease with this, and so we're watching really closely to that. We're also paying close attention to the reallocation of marijuana tax dollars that goes to pay for the treatment facilities that are also built into this measure, and trying to understand how that may impact our existing budget, because those dollars do come to us to help support existing substance use disorder treatment. So lots to learn here, and this is definitely on our radar. So that's all I've got.
Great. Thank you very much, Director. Commissioners, any last questions on those very quick last
No, I think,
pieces?
Lindsay, you did a very good job, Lindsay, of going over the high level details of what's happening. I certainly do appreciate it.
And Commissioner Sterrett, do you have any last? Oh, yes.
Just thank you for the work you do. I know it's been a long haul, and thank you. You're the perfect person for this time.
Thanks, Commissioner.
Yeah, thank you very much, Director. I really appreciate it. You've been in a marathon, and your team has been in a marathon at Public Health and everywhere else. And now it feels like we're in a sprint in the middle of the marathon, or maybe there's a big hill, or maybe I'm pushing the metaphor too far. But we're thinking about you, and we support you in this work.
Thank you so much.
Yeah, thank you. All right, we move on from our department updates to our consent agenda, which is item G. I was a little worried that we were waiting for her to say something more. Glad she's off now that way. And we have none on our consent agenda. We move on to item H, which is old business, and we have none today. Move on to item I, which is other business, and item I1 is consideration of approval to declare tax lot R3219AB 09499, a parcel of undeveloped real property acquired by the county through property tax foreclosure, as surplus property, and authorize the sale of this parcel to Jeffrey and Dana Coates, 700 East 5th Street, Newburgh, Oregon, 97132 for $3,001 plus fees and costs. And Christian, do you want to add anything more to this?
This is just another example of our efforts, ongoing efforts to sell pieces of property that the county has acquired through property tax foreclosure. We followed our normal process with this parcel. Since it's below $15,000, we advertised it, and then we provided notice to adjacent neighbors and adjacent property owners to see if there was any interest in the property. We did get some interest. There was a bid process And the Coates ended up as the top bid. And so this is now the next step in the process to declare the property surplus and to authorize the sale to the Coates of this parcel.
Great. Commissioners, do you have any other comments?
I'm not on property.
Okay. Well, thank you, Christian.
Mhm.
I would move approval of item I1 then if there are no further comments. All in favor signify by saying aye. Aye.
I,
Any opposed? Same sign. All right, let the record show unanimous approval of item I1. Good job, Commissioner. You did it. Item I2 is consideration of approval of the purchase of two Caterpillar 150 Joy-LR all-wheel drive graders from Peterson Caterpillar for $333,397.90 each to replace the units 18-157 and 18-158 to Peterson Caterpillar for a minimum trade-in value of $295,000 each. Commissioners, there's a great memo in the packet, but
Yeah, I was just gonna mention, I think it's a great memo. I think since we've started this program, and Mark has been a lot behind it, replacing our equipment where we can get a good trade-in value on it and not let it run it onto its last legs is definitely beneficial to all the citizens of Yamhill County because it keeps us from having a lot of broke down equipment and it minimizes our cost for the equipment, so.
yes, absolutely. Okay, well, thank you, Commissioner. I would move approval then of item I2 unless there are further comments. All in favor signify by saying aye. Aye.
I,
Any opposed, same sign? Let the record show unanimous approval of item I2. Item I3 is consideration of approval at the request of County Council to file a motion to withdraw the Yamhill County Board of Commissioners decision to approve planning docket C-22-19/SDR-35-19, which is board order 20-351 for reconsideration at the request of the applicant. The board order 20-351 approved a conditional use permit and site design for a flower processing facility and an on-site bakery as a commercial facility in conjunction with farm use. The applicant requests the withdrawal of the application. And I'm going to turn it over to Councilor Sadlow for further comments, maybe give us an update. But I want to say that this is sad to me. And I'm disappointed. And I understand the reasons that the applicants have withdrawn it. But with that, Councilor.
Yes, this would be the process for, I'm asking you to allow me to file a motion for withdrawal, for reconsideration to bring the order back before you. And then we would have, I believe, 90 days in order to make a decision, and we would probably do it much more quickly than that.
Yeah.
Because my understanding is that once the jurisdiction is back with the county, that the applicants will withdraw the application. And they want to keep their options open for other options open. So I feel that this is this is their preference to do it this way. We had a very long discussion about it, so it's not something that on the fly. Don't believe that they will be able to have the resources to carry this fight forward.
Commissioner Stewart, were you able to hear all that? I mean, I think you know the situation, but yeah.
yes, I was, and I would concur, Chair, that this is really sad because this project was fraught with challenges from the beginning, but it was just such the quintessential Yamhill County project, and I was really sad to hear that they were feeling that they were not going to be able to go.
Yeah. Commissioner, do you have
I
anything
feel
else?
exactly the same way. I think this is what agriculture in Yamhill County is all about, and Yamhill County is moving that direction. I'd like to see more of these type of entrepreneurship and small mom and pop in the rural area, and so I'm very sad that they elected not to move forward also.
Yeah, and I appreciate you working with them, and I appreciate the work of Lance and Ken Friday as well. And I want to respect their wishes, even though it's a project that we have clearly all supported for a while now. Yeah. Anything else you'd like to add, Councilor?
No, just need a motion to.
Yeah. We'll get there. We have to mourn first. Come on,
Yes.
give us a chance.
None of us are happy.
Yeah.
Staff's not.
Well, then, with sadness, I would move approval of item I3. All in favor, signify by saying aye. Aye.
I,
Any opposed, same sign? All right, let the record show unanimous approval of item I3.
Thank you.
Yes, thank you, and thanks for your patience. Item I4 is consideration of the ratification of a collective bargaining agreement between Yamhill County and AFSCME Local 1422, retroactive to July 1st of 2020 through June 30th of 2023. That sure felt good to say. And, or Christian, do you want to add? Sorry, I mean, it's good to see it here.
No, I'll just briefly say, you know, we, as we had announced at, following a very long and late into the evening mediation session that we had on November 6th, you know, we were able to reach tentative agreement and on a successor collective bargaining agreement, and the union did vote and ratified the agreement, and so I'm very pleased and very happy to present today, you know, this contract for your consideration this morning. I think, you know, it was a lot of bargaining. This was a long process that we started. Well, we got the demand to open negotiations in January, and we started negotiations in March. So this was a long process, and I just want to say, as the county administrator, you know, I want to say thank you to the bargaining team. You know, Christian was the lead negotiator in representing the county on this, and I just also want to recognize Justin as well, who was at the bargaining table. Justin Hogue at the bargaining table for negotiations. And then just highlight, you know, there was a lot of other individuals that were, you know, involved with this and helping the bargaining team, including all the department heads and managers. I also want to recognize that, you know, on the union side of the table, there was a lot of work on their part as well in preparing for, and, you know, and I recognize that anytime you're negotiating any type of contractor agreement, you know, parties, it's positional. It can be adversarial at times. It can be challenges, and recognizing it's a difficult process. But I'm quite pleased that the union and the county were able to reach agreement on a successor contract, and I look forward to continuing to work with the union and work with our employees, because I do think that this contract does provide, you know, especially with the salaries and data that we were sharing on both sides, as far as a recognition that we were behind in some areas when it came to wages. And this contract's going to go a long ways into remedying and addressing those gaps.
Yeah.
You know, and I just want to also go on record while I have the chance, is a lot of times when you're in contract negotiations and everything gets really positional, the one thing that I would like to emphasize, that never, it doesn't matter where we're at negotiating contracts or how we are, I never want it to come across or go out there that I don't recognize and appreciate the outstanding work that our employees do on a daily basis. I see it, I get, you know, and even under current pandemic, to where I'm not necessarily able to get out to the various offices and departments like I would like to, and that's, you know, the type of leadership style that I like to, you know, get out and interact with more staff. But it's an understatement. I'm humbled by the outstanding work that all of our employees in Yamhill County do. And I just wanted to just go on record and say thank you for all of their service to the citizens and everyone within the Yamhill County community. And I just want to emphasize that and say I look forward. I'm very proud to work with the Yamhill County team, and I look forward to working with everyone going forward.
Great, thank you very much, Ken. Christian, do you want to-
Yeah, I mean,
Yes.
I would echo everything that Ken said and, you know, thank him and Justin and the union and the bargaining team. I mean, this is the third union contract in this most unusual of years that we've been able to accomplish. And that speaks a lot towards everyone's willingness to stay engaged, to stay involved. And literally it was, I think, in the 11th hour, it was after 11 p.m. On that Friday when we managed to come to a tentative agreement. And so that was just, again, an example of everyone's willingness to stick at it and really see it through to the end. And I'm thankful that we were able to get it done. And I obviously want to thank the board's participation because we've talked a lot about the details of this and the other contracts that we've been able to finalize this year. With that, if there are any other questions you might have on any of the specifics, I know we've talked in detail about most of them, but if before you took a vote, there's anything else you wanted us to touch on, we're certainly happy to do that.
Yeah. Commissioner Olson, Commissioner Starrett. We're gonna go with Commissioner Olson first because he unmuted himself first.
I know, it never muted, so.
Yeah, exactly.
Anyway, number one, I'd definitely like to thank our negotiating team and knowing some of the stuff that our negotiating team, especially some personal things that were said that were totally uncalled for regarding our staff and our negotiation, but in the heat of negotiations, I realize that happens. I think the other thing to me is that I think the negotiated agreement could have been negotiated a long time ago. I don't feel confident that this negotiated agreement was in the best of all the employees. I think the negotiation was pushed among certain people, and I think maybe the vote shows that. But I'm glad to have it over with. And I go back to what Ken said. I think Yamhill County has some of the best employees around, and it's too bad when these kind of issues have to detract. I am not happy at all with some of the social media things that were done, some of the phishing and the spam social media letters that you get 250 to 300 of them, in your mailbox, which I know all of our commissioners got. But that being all aside, I think it was a very good negotiation in a very contentious time, and I'm hoping now our staff will be able to move on to more, I don't want to say more important things, but other important things.
Other important things and productive things. Commissioner Starrett.
Thank you, Chair. I think Commissioner Olson really said it very eloquently that we have excellent employees with great customer service. And I always say, having lived in 3 counties in Oregon, that Yamhill County has just, I think, the best customer service anywhere. And also excellent employees. I want to thank our staff. They did go through some pretty contentious times, and it was unreasonable and unwarranted attacks on them personally, which I just think are unconscionable. We do have excellent administration, and so I want to thank County Council, and I want to thank our Administrator Ken Huffer for what they put up with. But once again, I'm glad to see this has been put to bed, and I would make a motion to approve the ratification of the bargaining agreement.
All right, thank you, Commissioner. Any further comments? And I will say my comment then. Ken and Christian, I really appreciate your willingness to continue working and not walk away from the bargaining table. I know that we've had a lot of conversations about that, about we're going to continue. You put out good faith efforts. You set up meeting times, even though you didn't know if anybody would show up. And so I thank you for that. And thank you for working late into the night as you clearly got closer to an agreement. But I also want to really thank the union bargaining team as well for sticking with it. There's a lot of passion on their side around this, and they didn't detract them clearly from continuing to negotiate with you. So I'm grateful on both sides right now. And with that, all in favor signify by saying aye.
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 Any opposed, same sign? Let the record show unanimous approval of item I4. However, Ken had a comment that he was trying to interject.
No,
Mary did, yeah.
Thank you.
Yes. That one. All right, great, thank you. Item I5 is consideration of for extending provisions of the 2020 through 2023 collective bargaining agreement with AFSCME 1422 to associated non-bargaining employees. And do you want to add more to this?
No, this is just part of what we do with the contract is, extending certain provisions of the contract to the non-bargaining employees to make sure that there's, consistency.
Commissioners, do you have any other?
No, Mr. Commissioner, if there's no other comments, I will, being that it's normal that we do this, I will make a motion that we approve item number 5.
All right, thank you. All in favor, signify by saying aye. Aye.
I,
Any opposed, same sign. Let the record show unanimous approval of item I5. Great, thank you. Item I6 is consideration of approval of the purchase of Office 365 licenses with technical support from Tangent Computer in the amount of $161,492. And Commissioner Olson, do you want to add anything? And
Yeah, my only comment is, I think a few years ago, especially after Shane Hoffman came on, we made all the efforts in the world to make sure we had a good network security system.
Mhm.
We had valid software that were licensed to run, and that we weren't going to be caught by Software Publishers Association running illegal licenses on anything. And I think Shane has done an excellent job, and this is just to ensure that we can keep moving forward the latest version of everything, so we don't get stuck in a point where all of a sudden we have to put out a lot of money. So that's the only comment I have.
Okay, thank you. And Ken, do you have anything you wanted to add? It's a good memo that we have from, yeah. All right, great.
I'll entertain or I will make a motion to approve item number 6.
All in favor, signify by saying aye. Aye.
Aye.
I,
Any opposed, same sign. Record show unanimous approval of item I6. Item I7 is discussion of planning commission vacancy. And we've received comments in the packet with regards to folks who don't want Marvin Bernards. And I believe that there were, the way that last week, there was a request from Chair Armstrong that we choose from the candidates that they presented to us with the scores. Do you remember kind of the general framework, or do you need to have those documents in front of you?
I don't need.
Okay. So how do you want, oh, Commissioner Sarah, you unmuted yourself. How would you like to go forward with this?
so, we had asked the planning commission to rate those who had applied. I believe there were 2 candidates that were tied for the number 2 position.
Yep.
And I would just recommend that we appoint or approve their recommendation of Mark Gabler to fill the vacancy.
Okay. And Commissioner Olson, do you?
No, I have no comments. I thought both Mr. Bernards and Mr. Gaylor had excellent. I think that shows by the planning commission's evaluation of them.
Mhm.
So I have no problem appointing Mr. Gaylor.
Okay. The one thing I'm a little bit nervous about is I'm a little bit concerned that we are going to, so we received all these comments about the criminal record of one of the planning commission applicants. And it begs the question of, I don't know anything about the criminal record of any of the other applicants. And I'm wondering whether that's something we want to consider in the future, and whether we, do we do background checks on all of them before they even come to us? I'm just a little bit uncomfortable with this thing of the what is clearly one side sending us the criminal record of an individual, but I don't know anything else.
Casey, I know, and Ken could talk to this, because I had, with Ken and Christian, I had that exact conversation yesterday about running criminal background, not
Mhm.
financial, criminal
Yeah.
background checks and everything. And I think all the reasoning that they gave me, Ken or Christian, I want
Yeah.
to talk about that.
I'm just wondering, we have a tie here, and one of them we have had a lot of information shared with us about one of them.
When it comes to, these are citizen volunteer committees, and appointment, because they're advisory to the Board of Commissioners, so they're subject to the appointment criteria
Yeah.
and it's up to the board. We do not, run criminal background histories on folks in serving on these types of committees, because we also don't have, unless it's specifically called out in bylaws or rules or things, on what kind of finding in someone's history would disqualify them from necessarily serving on something.
Right.
I will say that there's certain, requirements that if it's like subject to CJIS, or, I go to CJIS in particular because that's something, the Criminal Justice Information System, that our law enforcement agencies use. And in order to be in their facilities, you have to pass CJIS, what we call CJIS clearance, which is subject to a background check, and, and there's specific rules around it. Again, there are certain rules, like on some committees, like the Planning Commission in particular, where they have to file with OGEC, as an example. So it can vary from committee to committee, but there's not really a hard and fast rule that says that in order to serve on this committee, you have to pass a background investigation, a background check, or that we're going to run a criminal history. And if we do find, what would exclude an individual from serving on that, what does the criminal history look like? Is it traffic violations? Is it something more serious, a misdemeanor, or if it's a felony arrest history? So it can vary. It's not a clear answer. I think if anything, I would look at the two attorneys in the room. If they're reviewing, if there's certain criteria that comes into excluding someone from consideration because of a criminal history, it could be there. I think on some of the comments that I've seen, the questions have been posed about the decision-making or things like that. And again, that's just public comment for you to take into consideration in making your decision.
Yeah.
But there's not a requirement that I'm aware of, or, to do a criminal history check and exclude anyone who's being, that they have something in their criminal history.
Right, thank you.
And I'll look
Do
at the
you want to add
attorney's
anything?
Yeah, I mean, I'm checking the board orders as we speak. I'm sorry, the bylaws as we speak here, and I don't find anything in the bylaws that would mandate either a background check or that would specify what levels of sort of criminal convictions or criminal issues would preclude someone from being on the commission. There is a requirement that members be appointed that they strive for geographic balance, but beyond that, those seem to be about the only membership criteria that I've come across so far. I don't know if you're aware of anything else. So yeah, as Ken said, it's information that's come to your attention. I think it's a matter of public record, and in that sense, you're free to consider it as you would any other piece of information. I appreciate the concern that you've heard about it from one perspective, but not from the other. There may be something out there to consider if but yeah, if you don't have that information, I'm not sure how else you can proceed than to go based off what you do have.
Right.
And I think the continued recommendations of the Planning Commission and staff.
Yeah, and just a second, Commissioner Sterrett, go for it.
Thank you, Chair, and thank you for that input. So when we're dealing with standards and we're dealing with representation of the county, I would imagine that we strive for high standards of those who participate in county government. Planning Commission are very weighty, very serious decisions. And when we're dealing with some, again, significant criminal charges against one of the applicants who is tied for second place, and we have the option of choosing someone who does not have those pending serious sentencing and criminal charges, I think that for us to say, well, it's not fair that someone who has a record isn't being considered. Well, I think if that is not a reason to exclude someone from representing county government, I don't know what is. And looking at past Planning Commission issues, years ago, there were several Planning Commission members who had significant criminal involvement. And those really did weigh down the commission. They caused serious embarrassment for the county, and they were very largely publicized. So I would say that when you have the option of choosing someone who doesn't have serious criminal issues that are currently pending, that one would choose the applicant who is not criminally involved.
Right, and before we go to Commissioner Olson, I just want to note, I'm not sure anybody said that's not fair. So I'm not aware of when somebody here in this room at least said that's not fair. But it did beg the question for me because I don't know anything about the other applicant besides what was in the packet during the Planning Commission. So I noted that, I just want to note that I'm only hearing from one side, as it were, in this situation. I do feel comfortable if we're going to look at things other than what the comments that we received are. I do feel comfortable that Mr. Gabler, as a farmer, is going to have a particular and important perspective at the Planning Commission. The one caveat to that is that if we're striving for geographic distribution, I thought that he was in the Carlton Yamhill area, and I believe that's where Chair Armstrong is also from, who's also a farmer. So I just want to, if we're going to go back to the bylaws, those are the two things where I'm like, okay, do we a pending criminal complaint or whatever is definitely a very important consideration. We do have other candidates though as well. So I just want to put that out there. They scored significantly lower than the tie though. So, but Commissioner Olson.
Yeah, I guess my only comment to follow up with Commissioner Starrett said is, number one, I think we're starting to see this trending more. After reading the applications, I thought Mr. Gabler was the best one anyway, but what I hated to see is that we have citizens and we have logical concerns that elected to bring this up to us. I mean, don't feel bad that they did, but I think it was actually done in order to help sway the commission's decision. Like we went on homework, and I just don't think it was, I hate to say drag somebody's name through the mud further than it's been, but I just didn't appreciate that part.
Yeah, and I heard that and in there is that your feeling was that you wanted to go given the two people with Mr. Gabler anyway. Yeah. Well, thank you very much for that. Commissioner Sarah, did you want to add anything more? I think we're at a good spot now, but.
I just think that the Planning Commission has spent, that was a very long night, and those interviews were laborious, and it was a difficult process for everyone. So if we ask the Planning Commission to make that recommendation, just like we do ask them to make recommendations on planning issues, we then have the decision, do we want to go along and concur with their decisions? I think in this particular case, we've asked them to vet these candidates. They have vetted them, and Mark Gabler is clearly who their choice would be, barring a candidate that has criminal issues. And again, I would go back to saying that I don't know that that would be anybody's wish, that we have someone representing the county with those concerns.
Yeah.
So I would suggest that we appoint or accept their recommendation of Mark Gabler.
Okay, sounds good. And let's. Is that sufficient for a motion, Ken or Carolina?
She did make.
Oh, did you? Okay, sorry. I just heard that we should recommend it, but great. All in favor, or is there any further comment? All right, all in favor, signify by saying aye.
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 Any opposed, same sign? All right, let the record show unanimous approval of the appointing Mark Gabler to the Planning Commission. That was what your motion was, correctly, Commissioner?
Yes.
Okay, good. I just want to make sure I repeated it correctly, since it wasn't actually item I7. All right, with that, we move on to item J, which is public hearings, and we have none today. And we move on to item K, which is announcements and commissioners.
Well, I'll just start by the last couple of days. I've attended some of the AOC conference, the general session, and some other governmental sessions and whatnot. Team building, I'd like to say I got a lot of information that was usable, but I really didn't, because I don't think that kind of conference is the kind of conference that you do remotely, because most of the information you get is talking one-on-one with a lot of your fellow colleagues and a lot of the State Department heads. And I just didn't see this. So my recommendation, if they ever did this again, I don't know if I would actually spend the money to register and go to this type of a conference, because I just don't think it was the trivia stuff and those sessions. I just don't think it was worth spending the money to register for this conference.
Yeah.
In this format.
I only made it to a few because I was getting phone calls in both ears, but it was on the computer there. Commissioner Sarah, what would you like to share?
And thank you, Chair. I agree with Commissioner Olson. Having gone to previous conferences that were just jam-packed with really valuable information, and the networking and all of the information that they shared with us in some of those individual seminars, it was devoid of that this year. It was light on content, and the virtual aspect was challenging. So I totally agree with Commissioner Olson. This was not something that I would recommend spending time doing in the future, at least not with the way it was set up this year. Disappointing.
I was never able to get a 10 to 5 to work as a confession, so I had to just do the individual
The
Zoom
second day
links.
they got it to work.
Yeah, I still struggled with it.
Yeah, I do have.
I don't know why.
I do have one other
Yes.
announcement, and I don't want to take Mary away from her announcements, but I think it's fairly important. This morning, we had a very important Parkway Committee meeting.
Yes.
We had a lot of people there. Matter of fact, almost everybody on the Parkway was there, and what we did, our main option was to get a presentation on the 3 different options for phase 3 from Dayton to Dundee and how they would intertie with phase 1. They gave basically 3 different options. The group was very adamant that we wanted an option that would keep us within the corridor. We didn't want to have to go outside the corridor and go through all the land use processings and hearings, again, because we could have potential of losing funding. And we wanted something that definitely met the needs of Dundee, but also met the needs of everybody else in the county of bypassing it.
Right.
So I think we came up with a pretty good option, and it was consensus of the Parkway that, and this will all be coming out, I think when Carrie gets the minutes out, hopefully, and a copy of the presentation that we elected to go with what they call option N8, which actually uses some of the internal streets within Dundee
Okay.
as part of the bypass itself, and it's a little bit more expensive, but what it does, it increases our chances because Dave Hageberg reported that this Representative Fazio has already met with the transition team and with others of Build America, and this is very close to being shovel ready. We think that potentially we can get full federal funding, so there would be no state funding involved from ODOT. There would be no local match, because being that it's a highway of significance important, it's a priority freight corridor. It's high on the list of emergency evacuation routes from the Central Oregon coast, that we think we're in the pump that we could potentially get the federal funding to fund the whole project, which would be completion of the whole bypass would be about, or phase 3 is about 140 million when you talk about the property acquisition and engineering, but we think we have a good shot at that.
Wow.
So that was a great meeting.
That's fantastic. And anything, so that was focused primarily on phase 3 then?
Yeah.
Anything more on phase 2?
Phase 2, parametrics and ODOT, and I can't say enough for John Houston at ODOT, and who basically picked up the ball on phase 3 and carried the ball himself, or we wouldn't be where we are. But phase 2, parametrics is still working on the final engineering designs. There's just a couple pieces of property they're still working on, but hopefully that will be done in the next 2 to 3 months, and we'll be able to start moving forward on doing the rest of the property and the final engineering for phase 2 to get us to the top of Rex Hill.
Wow. Well, great. Thank you for that. Thank you for attending that too. I had 2 other things I had to be at this morning. And then Commissioner Sarah, we're coming back to you.
No, I just wanted to say thank you to Commissioner Olson for the years that he spent on the bypass committee.
Yeah.
And I think that historical knowledge is really vital. I hope that you'll somehow stay involved in that. This is really, really good news, and it's just been years and years, decades of work. So thank you for the early mornings and for attending those meetings and being a part of this.
Absolutely.
Thank you.
Yeah. And somebody said that they wanted to call it the Hagerberg Highway. But I was like, we should probably sell off the rights to that, auction them off, right? I mean, make a little bit of money off of it. Maybe auction it off to Hagerberg.
Well, just to let you know, they're estimating right now that it'll take about 75% of traffic off 99W, which is critical to the businesses and the people along 99W, and the way that 99 between Archery Summit and Bremen Orchards is developing. It's critical that we get a lot of that traffic off of 99.
Oh, I agree. And I'm excited about phase 3, but I got to say that the phase 2 and taking traffic completely out of the city of Newburgh is going to be such a big deal. Yeah. All right, Commissioner Starrett, what else would you like to share, or if you don't?
I have updates, but I just want to comment on that.
Oh, yeah. Please.
So I believe Mr. Huffer, or perhaps Carrie, if she's there, has a letter I wanted to share with the commissioners to see if you would be interested in taking a look at that. I have given this letter to the chairs of the other district, Carolina has it, thanks Carolina.
Thank you.
The other District 6 chairs, and that was our response to the governor's freeze. So I'll give you a minute to just look at it, and basically it's just a concern that we have regarding the impacts to our businesses and the secondary impacts. So I've asked Commissioner Willis and Commissioner Pope have said that they will sign on and their boards would sign on at this juncture. Commissioner Willis and Commissioner Pope believe that their boards would sign on to this letter. And I'm asking if you would be willing to sign on for Yamhill County. In lieu of that, we would ask that the other chairs of District 6 sign on a similar letter. But really, the letter just talks about, we're asking the governor to reconsider a one-size-fits-all approach and asking for some more input from our businesses and business organizations. So if you've had a chance to look at it, perhaps I would entertain perhaps a discussion on this letter and whether or not you'd be willing to sign it.
Well, I just got this now, but the one thing that stands out is that in our email box, we have the moved from a one-size-fits-all to a county specific. And so I from the governor's office. So that's kind of, I wonder whether you might want to reconsider the language of it in light of what's sitting in your inbox. It's still a draft, I believe, but.
Well, I did see it, yes.
Oh, okay.
I did see it. I know that we are going to be sending this out because it is a little late in the game to be asking for input from the counties. The freeze has been put in place. The one-size-fits-all is currently what we're operating under. So while I think it's too much, too little, too late, I do appreciate the governor asking for input that she did the other night. This was on the eve of administering a freeze, which basically has a majority of our businesses shut down. So again, this is what we're operating under, and I would just ask that you consider signing it, because while the discussions now are, they're reaching out to the counties, again, what good does it do us when this is what we're living under today?
Okay, well, I would just push back, Commissioner Sarah. It says, once again, our local elected officials, public health authorities, and businesses were not invited to the table. And I'm confused because we were at a conversation with local public health authorities and local elected officials together. And so I don't know what your I don't understand what you're asking for now that's different than what the governor has done with you present and with guidance that's going to be applied on a county by county basis that's in our inbox. I just don't know. I feel like this letter would have been better like 2 weeks ago.
So actually, that meeting that you talk about is a meeting that occurred prior, that was right before the freeze was announced. So the governor was asking us on Tuesday night for input. We knew that at midnight, so a few hours after our meeting, this was going to go into effect. So that asking for input as you're about to implement a freeze is really a bit, I'm going to use the word disingenuous. So yes, there has been a request for us to weigh in. We've been trying to weigh in all along, and we just got that request Tuesday night.
Right, but this is this is not, I'll provide some opportunity for Commissioner Olson, but I feel like this is like a Back to the Future kind of scenario. Like it feels irrelevant now if we're going to use words like disingenuous, considering what state of affairs we're in right now. But I want to pass it over to Commissioner Olson.
I guess my feeling is, through this whole thing, the state has always said, we want the county to be involved, the elected officials involved. We've given all sorts of advice. We've known what should be done with school openings or school closures, for business openings and business closures. I've yet to see hardly any of the counties, not just us, but any of the counties, advice taken. And then the decision she made on this pause, to me, that was preordained. The pause was done, everything was done before in that Tuesday night meeting, before she even asked for the county's input, because no commissioner was going to get together between 10 o'clock Tuesday night or 9 o'clock Tuesday night and first thing Wednesday morning to discuss it and put everything in place. So my opinion, this was just all preordained. And I agree totally with Commissioner Sterrett that her asking for it was a nice thing to do, even though she knew that it was impossible for the counties to give that kind of input. When we've tried to give input all along on school closures, on reopening the schools, and they haven't listened to us. So
right. So my understanding of the freeze, forgive me, Commissioner Sterrett, I will immediately open the floor to you again, was that the freeze was intended to try to do as much as possible to retain hospital capacity. And then the metrics that we have in our inbox are the county by county approach to COVID going forward, based upon the input from the meeting. From what I saw, at least, it did take into account
I'll agree
the
with
comments.
that, but if anybody thinks that this 2-week pause is going to be a 2-week pause, I think they're following. I think they're just kidding themselves. It's going to turn into a 4-week pause or an 8-week pause, and our economy just can't take it. Our school children can't take it. The best place to have kids in a controlled environment is back in the schools. I think the way to stop the spread, myself, and this is just my personal opinion, one of the ways to stop the spread is to put kids into schools where they're in a controlled environment, which they have much more control there than they do at home, and who they go out and play with and what they wear. And plus the increase in suicide, the increase in healthcare. I just think that this letter is well done, and we have to say, hey, Governor, that, you asked us for our input Tuesday, but you want this to go into effect Wednesday, and you put this into effect Wednesday. I think disingenuous is a very nice word that Commissioner Sterrett used.
Okay, and I want to respond to Commissioner Olson, but I want to make sure that since you're not in the room, you get a chance to respond. So Commissioner Sterrett, thank you for your patience.
Thank you, Chair, and thank you, Commissioner Olson, for those words. A couple of things I wanted to say is that it is not irrelevant to say that the letter is irrelevant now. It is not irrelevant to the gentleman with the business who wrote to all of us commissioners telling us that basically closing his business down on top of the past closures was basically going to do him in. It is not irrelevant to the woman who is now trying to get a death certificate from the state because her 13-year-old committed suicide. It is not irrelevant that our restaurants are once again shut down. This is not irrelevant. What is irrelevant is to ask for commissioners and ask for input and provide a sort of a feel-good, throwing us a bone. The day after this has been instituted is, I believe, very relevant for us to ask the governor's office to listen to us and not to just give us lip service.
So maybe I should modify that. I think it's irrelevant to say to the reconsider this one size fits all, because that's actually what I was referring to. Because we do, again, I just want to note that, so Commissioner Olson's concern is that a 2-week freeze will become a 4-week or a 6-week. But what is, forgive me, if you didn't hear it.
That was one of my concerns. Only
Yes,
one of my
yeah.
concerns.
But so forgive me, what I'm trying to explain here is that what's in the inbox is the draft of what's going to be implemented as soon as the 2-week period is over, right? It's a replacement for phase 1 and phase 2, which Commissioner Starrett and I were both on the call where the governor talked about that. And so I just want to, I understand the letter. I understand your sentiments, but for the general public, I don't want there to be some impression that this is something that's going to continue on, because in theory, at least, what is the email that we all received is how the state is going to approach it going forward, which is a county by county basis, right? And so that's the thing I want to communicate, is that I understand your comments. I understand your comments, Commissioner Starrett. And I also want to say that that's what's sitting there is a county by county. And I talk to people all day, every day about this issue. One of my neighbors drove into my driveway while I was on the phone talking about the $55 million business relief grant funds. And he said, don't let us be a region or a state. We need to be our own county. And I wholeheartedly approve of that each county is going to be judged based upon its own case counts rather than based upon the case counts in Portland, for example. Sherman County really needs to be judged on Sherman County and not on Portland. I think that's really important. And that's what is sitting, that's the proposal that's sitting in our inboxes right now.
One thing, Casey, that I read all that in the inbox too.
Yeah.
Where the governor talks about the 4 weeks, you have to be at the same level for 4 weeks before you can go back another level. Well, let's say you're at 3 weeks and then it spikes up again. Now that whole 4-week cycle starts again. And if you look at where, especially like the restaurants, the small merchants are, I'd like to see OHA say, give me stats saying, okay, the big box stores, the small mom and pop stores, the restaurants, how many COVID cases were reported there? I don't think they had a thing to do with the increase in COVID cases. It's all sporadic spread. And I think this is something that once we're at that, the 2-week pause is over, and we have to look at what the counties can do and stay at for 4 weeks before they can go to the next level back or the level they were at.
Sure.
It's never going to happen. But that's just my opinion.
But that's different than whether or not it's a county by county versus a one size fits all, right?
Well, that's why I think it's not county by county, because they set they're setting, this is what each county has to do. You know, after the 2-week pause, you have to maintain 4 weeks of this, and then you can go back. Well, that's not the county deciding. What if the county decided we want to be 2 weeks where we're at? What if we want to be 1 week? This is the state.
Oh, I see.
So
your view of county by county is that each county decides for themselves what their restrictions are, or that kind of thing. Is that?
That is exactly part of it.
Okay, that's helpful to me to understand.
That's part of it.
Commissioner Starrett, thank you for your patience. I really wanted to focus on what Commissioner Olson was saying, so sorry, go ahead.
No, I appreciate that, Commissioner Olson. I think that is a brilliant point, because one of the things we have talked about is the Board of Commissioners is the local public health authority. The local public health authorities, i.e. the boards of commissioners, have not been considered in any of the decisions, or their input has not been noted when the governor has made policy. And when you realize the importance of why the boards of commissioners are local public health authorities and the mental health authorities, and we've not been considered in this, I think it's critical to the discussion. The other thing is, once again, it comes back to the 11th hour and how we've had goalposts and we've had hoops to jump through. And we've jumped through and the metrics have changed and the positioning has changed. But at the end of the day, what hasn't changed is that we have people who, see everybody in these rooms, my office here and in that room where you are sitting, none of us have missed a paycheck. None of us have lost our health insurance. And yet I'm hearing from people, and you are too, from people who cannot stay afloat and are at the point of despair. And then we hit another one where it's like being a battered woman, where it's like, I promise I'll never do it again. And then slam. And then there's another beating. And now she's going to throw money, the governor's going to throw money at us under the guise of business grants and say, okay, honey, I might smack you around all day, but I'm going to take you out to dinner. You'll feel better. That's not good enough. And it's critical that we remember that these are people's lives. So yes, I'm angry and I'm frustrated for these people.
Okay, and my response to you is, Commissioner, if you were making the decisions, what would you do right now? Bearing in mind that I would expect that you would wholeheartedly endorse the measures that our local public health director, our HHS director, has asked us to work with on. So what would you do under those situations here right now in a way that actually is effective? I would love to hear.
That's a very good question, and I'm glad that you asked it. The health director, our HHS director, basically works in concert with Oregon Health Authority. I've never seen an HHS public health director ever step outside of the bounds of what the state has prescribed. Now, to me, that is not what the governing body does. We don't make policy based on state agencies. We make policy based on the best interests of our constituents. Now, if you want to look at the mask mandates and look at the fact that we have been told to wear masks, and yet we continue to see these spikes. So we're going to up the ante and we're going to say you're not wearing masks enough. We're going to up the ante and say, oh, we're going to limit capacity to grocery stores. We're going to up the ante and say you can't go to church, you can't have this many people. I mean, at what point are we seeing that these measures are not working? I say that we ask for people to make individual choices based on good decisions. And if you're sick, stay home. If you're not comfortable going out, don't go out. To shut down an entire economy for a virus that is 99.8% not mortal, I think has been a big mistake.
Okay, so thank you, Commissioner. I appreciate hearing your thoughts on this. What we heard earlier today was a plea from our Director of Public Health around things like wearing masks. And you've asked that people respond by doing the best they can. But my question for you then would be, what happens when our hospital is full? And I just want to point out that right now in Oregon, we have a 1.4% case fatality rate. That's a lot of people in our community, right? And when a hospital fills up, it's not just the people with COVID who suffer. So I want to know from you, what does that look like? At what point do you approve measures that affect our outcomes?
That's a great question, and I'd like to go back to the hospital capacity question. So from the very beginning, when we were asked by the governor to help flatten the curve, it was because we were concerned about an overwhelmed public health system and an overwhelmed hospital system. That never happened. The numbers and the metrics and the formulas that were used back in March were absolutely 100% incorrect, and we continue to use that same methodology. We do not have an overrun hospital system. As a matter of fact, we had to furlough hospital workers, nurses, and doctors and practitioners because there wasn't enough work for them to do. Now we're saying we're worried about more hospital overrun. It hasn't happened, but it's the big boogeyman we use as the bludgeon to tell people that they cannot do what they do normally and should be able to do constitutionally.
So I just want to acknowledge, Commissioner Sterrett, that at least if you talk to people at our local hospitals, they're pretty exhausted. If you talk to people in the Providence system, they're pretty exhausted by this. We have, with those metrics to replace a one-size-fits-all, an update on the hospital capacity around the state. So I don't want the public to be left with the impression that our hospitals are doing just fine.
Did I say that, or did I say that we've never had an overwhelmed hospital system as a result of, for instance, ICU beds? Look at the number of ICU beds that were in use at OHSU. Look at the number of COVID hospitalizations as compared to the number of other beds in use. We've always had the capacity, and we continue to have the capacity, but this seems to be what we use as the bludgeon, or the worst case scenario. It never happened, and I'm not saying our hospitals aren't dealing with difficulties, just like they do every year when there's influenza-like illness and respiratory issues. But to say that our hospitals and our ICU beds are beyond capacity, they never have been.
But that's what it says right now, severely constrained capacity in the metro region. That's what it says on the email that you just received.
So when
And
you
it
say
also said,
constrained,
go ahead, sorry.
no, I was just gonna say that, if you look at what the ideal is in the ICU in terms of cost ratio, you want your ICU beds to be filled. If they're not filled, you've got a very expensive department that is sitting there not paying for itself. So we've never had overrun in ICU, and yet that is what we're saying. If it is constrained, it is not overrun. So what we're talking about here today, Commissioner, is whether or not we would like, as counties, to have more input and not given the opportunity to weigh in the night before the freeze, which is now in effect, goes into effect.
And we've had the opportunity to weigh in, and now there's a replacement for the one-size-fits-all sitting in your inbox. So I don't feel like this is a document that really is timely. That's just my perspective on it. And with that caveat that there are many important statements in here, there are also many statements that bless you, either lack context or lacked evidence. And I'd be happy to sign on to something in the future that provides that clear context and evidence. But I appreciate you bringing it forward. I want to make sure, just like, oh, sorry. I just want to make sure that Commissioner Olson has an opportunity.
Yeah, no, my last thing
Bless
is, we've talked about this for about an hour now, a little over an hour, about a letter, whether we should sign it as a board or whether we should sign it as a board. Personally, I believe we should sign it as a board, but it's evident that all three of us aren't going to come to the same conclusion on this particular letter. So I think what that leaves us is that we did this before. It wasn't too long ago, where two commissioners signed the letter and one commissioner didn't. And
Yeah.
I would like to see all commissioners. Now, they could have the same thing in Polk County. Two commissioners sign it, one may. But I think this is a very relevant letter. If it does more than say, hey, we're tired of you doing this, asking our input, and then not even consider our input. She would have came out a week and a half later, 2 weeks later with her pause, and then this stuff, that would have been, I still want to like them, but it might have been more tolerable. But to do it and then make the decision that next day, I think it was totally wrong from the governor's standpoint. But that's just my opinion, where I stand with the letter, which we started on. If we have two commissioners who want to sign it, or one that does and two that don't, to me, that's fine. I think that we've discussed everything around it, except we haven't really discussed if we're going to sign a letter.
Right. And then, thank you. And then Commissioner Sterrett. I just wanted to make sure that we got everybody involved in the conversation. Commissioner Sterrett.
Thank you, Mr. Chair. Thank you, Commissioner Olson, yes, I would then recommend that Commissioners Olson and Sterrett sign a letter, and that Commissioner Kula go on record as saying he was not willing to sign the letter.
Oh, yes, Ken.
Oh, I'm just looking procedure wise. I think that this letter's gonna come forward. I think the first action would be, if we're gonna consider this as an agenda item.
It's not, yeah, it's not on the agenda.
It's not on the agenda,
It's
no.
not even on as a discussion item, but if the board wants to move on this, you could take a vote.
Yeah. One thing that
And
I
if
would
this letter's
appreciate.
gonna go out
Oh,
under
yeah.
the name of, representing the board, I think you should take a vote.
Right, right. If it's a matter of the majority of the Board of Commissioners, and then, yeah, we should take a vote. But if that's the case, I feel like this is a significant enough statement that lacks evidence and it lacks context, and there's frankly, like, statements that I think are fully incorrect. I think that this should be in the agenda packet so that people can provide comment on it before we take a vote on it. That's just my personal opinion. Because people out there in the world, they don't know what we're talking about right now.
Right, so go ahead.
Oh, he was just blinking, and so I thought he was about to say something.
Well, no,
He
I just-
unmuted himself.
I was just thinking of what you said, and I agree with you, except this is action the board is taking, and like a lot of other board actions, some agree and some don't. And I think we should take a vote on it, either do it or not, and if one opposes it, then one opposes it. And then the letter itself could become part of the record, because I can tell you what, this is not something that I'm willing to wait 3 weeks on, 4 weeks on, 5 weeks on. I think this has to be done, and it has to be done to get the impact, it has to be done soon.
So my view of it is that if this is a statement that's being made by the Board of Commissioners, it's a significant enough statement that I think it should be in the record so that people can provide their public comment on it. Don't you like having
Well, I think
people's
it should
public
be-
comment?
I should think of it, yeah, and I think they should be able to provide public comment on the letter after, if we sign it in, 2 commissioners sign it and 1 don't,
Mhm.
and then it becomes part of the packet, and people want to if we want to make it part of the public record, and people have access to it, great, but I don't think that necessarily, we should solicit, in this case, I don't think we should necessarily solicit input from every citizen, because we're gonna get the exact same thing the 3 of us are talking about. We're gonna send a letter to say, commissioners, you did a great job, we wanna open things up, and some are gonna say, commissioners, you're making your fools, you're making a thing, so I don't think the public comment in this letter would change anybody's mind about anything. So should we make it available to the public? Yes. Should it affect if we vote on it or not? No. And then as individual commissioners, this is where I lie. Like, if you don't vote on it, Mary and I do as individual commissioners, if people don't like the way we voted, that's great. We're individual commissioners. We made the choice. And if there's people that think you don't want to open up which isn't true, but don't want to open up the economy, and they come down on you for not voting for it, that's your right as an elected official representing our citizens.
Right. I just think that an alternative option is for each of you to sign this separately, since it's not on the record, it's not in the agenda packet, and it's not on the agenda as a discussion item. But I want to make sure. Sorry. You're over there, Commissioner. Well, you're over there, but Commissioner Olson is here. Did you have anything you wanted to add to that?
Thank you, Chair. Thank you, Commissioner. Yes, I agree with what Commissioner Olson said. We've done this in the past, where at the end we've talked about letters to sign and letters not to sign. And I think that at the end of the day, there is some urgency. This is time sensitive, and that for us to wait, for us to discuss. I know that Commissioner Craig Pope and his board will be signing this. I know Commissioner Brentano will be signing this, and Commissioner Willis will be signing this. I know that Commissioner Cameron did mention on the call the other night that he was not signing on to any letters. I believe this might have been one he was referring to, but as far as the other commissioners in Yamhill, Marion, and Pope, there was consensus that this was a letter that we would sign. and we would sign it individually. And so if we don't have a full board, then I would at this point suggest, and I would make a motion when it's appropriate to make the motion, that we sign this as a board, and if not, that Commissioners Olson and Sterrett sign the letter.
I have no problem with that.
Sounds like a good motion. I heard a motion, I heard the word motion and all of that in there, so.
But if you don't feel like, and I just want to clarify, if
Yeah.
you don't feel like signing it as a full board, and Mary and I do want to sign it, we will sign it as individuals.
And I do recall Commissioner Cameron saying that. I thought it was about a letter that I believe you forwarded to Christian and he forwarded to us. That was the one with all the signatures from the Eastern Oregon legislators.
Yes.
I figured that that was the one that he was referring to because I hadn't seen any of them at that point.
Okay, I think we have a motion on the table.
Yes, we have a motion on the table, but Commissioner Sterrett had her mouth open.
I want to make sure I understand what Commissioner Olson was saying. If you're saying if there is a 2-to-1 split, that you would not necessarily sign the letter on behalf of the board, but that you would each sign it individually? Or is the motion that even if there is a 2-to-1 split, that the letter go out stating, for example, that it is the Board of Commissioners that stand in agreement?
I believe that the motion from Commissioner Sterrett was if it's a 3-0, that it goes out as a board. If it's a 2-1, then it goes out as individual commissioners.
Okay, so that'll
That's
be
how
determined.
the motion
How it
was
goes out will be
read.
determined by the vote.
Yeah,
Okay, I think that's reasonable.
okay. All in favor signify by saying aye.
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 All those opposed, same sign. Aye. Let the record show Commissioners Olson and Sterrett in the affirmative and Commissioner Kula in the negative, I guess. Yes. Sounds bad.
Well, again, a great discussion among the commissioners. It's nice to see commissioners are actually all talking to each other.
Well, Commissioner Olson missed the fireworks while he was gone. We're winking to each other right now.
Good. I only have so many things left, you know.
Yes. Okay. Commissioner Sterrett, is there anything else that you have as an announcement?
Just real quickly, just an update, I did testify in federal court in Portland on Wednesday, Tuesday, on whatever day it was, I lost track. Believe it was on Tuesday. And that was for a preliminary injunction against the governor's office for the religious schools, that the faith-based schools are feeling that they are not being allowed to operate, and then it's against their First Amendment rights. So the judge denied the preliminary injunction, which would have caused the order to be lifted, and instead there will likely be a jury trial in 5 months. So that one of them is a school in McMinnville. So the Christian schools are asking for some relief from that. And the other one was that we are now moving things along a little bit with the FAA. And, you know, we've tried to get some movement going on the Sportsman's Air Park to get a development rights pilot program. At least we're just advancing the discussion so that this airport can stay viable. But again, it's been at least a year in the making, and we're just now getting some movement. And I want to thank Christian for hanging in there for all this time.
I mean, Commissioner, I've just been sort of standing in your shadow. I mean, you've been leading this, and I will continue to do what I can, and we all will. I think the information that we just have actually gives us some additional guidance and some additional information to hopefully be able to bring something of additional substance to the board here relatively shortly.
Well, the fact is.
That's progress.
Christian just wants to be able to commute by air to work, so it's easier to get on a plane there and land in McMinnville and then have his other car here and drive.
Wow.
At least until we have the Hageberg Highway.
Yes.
Way to bring it back around. Yes, thank you very much. All right, well, thank you, Commissioner, for working on that project, even though it's slow. All right, so I have, don't worry, it's not very long. I just wanted to bring up the business relief funds that are being dispersed to counties as part of that $55 million. Ken and Carrie and Abhisha and I were sending emails back and forth rather quickly yesterday around it. And since we have fewer and fewer meetings before the end of the year, And while the funding appears that we won't have to spend it until probably sometime in January, because it's really on the state to send it out to us. And then that ends their clock. I want to make sure that we have at least the beginnings of some ideas out there. And Ken has, I think really the most important thing from Ken's perspective, well, the most important thing that I hear from Ken is the budgetary authority and kind of how that works. The other part of it is staff time associated with getting that funding out to businesses. Two options were identified, and obviously I'm just trying to lay the groundwork for a discussion that we maybe can either have at the December 3rd, December 10th, December 17th to make a decision. But one of the options is to essentially apply that any funding that the state provides to us to the community relief or the community requests that are pending right now. We have 93 applications that are eligible and who have funding that's in the window that we've provided as a cap. And it looks like we could fund all of those eligible applications with the funding that's coming from the additional funding that's coming from the state, which would be a really simple way to do it. Because right now the team is going to have to decide which baby gets to stay and which baby has to go, as it were, which application for relief. So that's a really simple way to do it. We plug it into the system we already have in place. Another option that was suggested is that we contract it out to either the COG or to Willamette Workforce Partnership. So those are two ways to get it out to people and to their businesses really quickly without adding to our workload. And with that, I want to make sure that Ken has.
Right, and so there's thank you, Commissioner, because the one thing that I just want to be really careful with, is I was probably in the same position as many of you. I was actually at the time at an AOC doing our administrator's business meeting when this announcement came out. And up to this point, I haven't seen anything beyond the press release that has come out from Regional Solutions and a couple other places.
Yeah.
One of the concerns that I have about necessarily, and I recognize that there's going to be need and there's a push to get these funds out to the businesses that are currently being impacted under the freeze, and trying to help with the whole pandemic. I saw a little bit of some, criteria in the press release, but we haven't seen the full criteria. Is it just going to strictly be the Treasury guidance under CARES Act?
Mm-hmm.
Is the state releasing these funds going to be that we have to make sure we fit into certain boxes or criteria?
Yeah.
So the only reservations that I've had, and I've shared this with the emails, without having an agreement from the state, which they're not going to release the funds to us until we sign an agreement. That's just typical with all of our interactions with this type of funding. That we be careful about not necessarily making promises or committing on a certain path when we haven't seen what conditions or strings DAS or the governor's office is going to, put on the use of these funds. That's the first part. And then the second part that's an unknown is AOC and working with a couple of my counterparts, and namely in Jefferson County. They've been doing some estimates on what the formula would look like, but we haven't seen anything come from the state. There's some question marks about the amount of funding that's going to be available to Yamhill County. And some of that is also influenced on whether or not Multnomah County and Washington County is included in this or not included in this, because they received direct funding, or at least the cities within some of those guys got some direct funding. So the dollar amount based on our estimates that we've put together and shared could be anywhere from 1.2 million or just over 1.2 million, or potentially up to 1.9, closer to 2 million. So I think there's a lot of
big range.
Or
down to 500,000 even.
Right,
I mean, that might be as low as it goes too.
yeah, and the minimum amount is 500,000.
Mhm.
You know, I mean, that's what they established there. So, you know, I recognize that we definitely want to, and even in the press release, they said that they would have payments ready to release to us in several weeks. You know, and I'm kind of saying that because we're already starting to get calls at the commissioner's office. Staff we're getting calls yesterday about, hey, how do we apply for this? And it's like, we haven't received the check yet, or even come up with to understand what the criteria is. So it's something we're gonna be working on. That's why I'm kind of like, you know, I'm just trying to like, let's take a deep breath for a moment. You know, only because I think once we get more information from the state, I think I will be better able to give you information so you can make informed decisions about which direction you want to go with this. The other part that we're also going to need to talk about is with this funding that's coming through and a lot of the other CRF funding and the pass-through and some of the other grant programs, and also with the collective bargaining agreement that we approved today. There's a lot of things in play with the budget that I have concerns about whether or not we actually have sufficient appropriation authority. That if we received a check today, that I don't believe we have enough appropriation authority in the individual budget that we could in turn start issuing checks or start using those funds. And then still have enough appropriation authority for the rest of the year to, you know, to carry out all of our other budgeted expenditures that are already called for in the budget. And so part of that is going to require, and I've already done some preliminary analysis based on some of the needs. We're gonna need to do a supplemental budget, and looking at it in order to do, you know, especially for this $2 million to come into an individual fund, more than likely there's very few funds that you would logically place this has, you know, sufficient appropriation authority.
Yep.
And so it's going to exceed the 10%. So in order for us to adopt a supplemental budget to incorporate and allow access to begin to use these funds, we're going to have a public hearing. And, you know, at least a public hearing and all the noticing requirement that goes out associated with the hosting a budget hearing.
Yeah.
So I know I just threw a lot at you, but there's a budget, and then there's the pending what strings the state's gonna have. And I recognize that the state is wanting to process this because much like a lot of our grant programs, we're going to want to finalize agreements and get funds out to projects that have been approved before December 31st, so then we can be sure that it's an eligible expense under the CARES Act. And so I recognize they're doing the same thing. And, you know, so there's a bunch of steps, and I recognize that maybe December 3rd or December 10th, we may have a better idea because we may see something here in the next few days from the state or from DAS on what an agreement. And then recognizing the board's going to have to, more than likely, it'll probably be a new agreement that the board will have to take action on as well.
Yeah, exactly.
All right. I'm sorry.
Great information. Thank you, Ken.
Well,
I saw Commissioner Olson wanted to say something.
No, I guess my own opinion is the more I look at it, if we have to do the supplement, which we Ken and I talked about yesterday, the supplemental budget and have the right budget authority, have a place to put the money, you know, have a place to take the money out of. That, if you look at the holidays now coming up, being able to, I think we have to spend that by January 31st, or we allocate it by January 31st.
No, if it's my understanding correctly, the obligation, because these funds are being, the state is the one experiencing the expense that they're going to report to the U.S. Treasury. You know, I don't know the details. This is what
That's what I
I'm
heard
making
too.
a big assumption here, but, and just seeing on the push in order for them to release the funds to us is that they now are having the expense that they're going to be reporting to get reimbursement. Once we have the funds, you know, I think whatever is detailed in the agreement that we get from the state is going to dictate what that timeline is and making sure that we're in compliance with the CARES Act on how we're using those funds. That being said, but I also recognize that we're currently in a 14-day freeze. A lot of businesses are closed. A lot of businesses are feeling the impact. So, you know, there could be a lot of frustration because there's a lot of potential business needing to access these funds. Unfortunately, it does get caught up in, you know, government bureaucracy at times because I just need to make sure that we're in compliance with Oregon budget law and we're not creating any exposures to the county. We want to get the funds, you know, we're basically acting as a pass-through from the state to get these funds out to the community.
And we just need to know what our reporting requirements are. You know, really, that's the base level of it.
Yeah.
I want to, it looks like Christian wanted to say something, but Commissioner Starrett, did you want to add anything?
Thank you. No, I know it's very frustrating. It's sort of like we're sitting on this money that we actually should have gotten, we've been begging for, and now it's, you know, we're up against the clock and we have to hurry up and get it, especially now that we have so many businesses in need. So I echo that frustration, but I also would love to see that we're going to be targeting the businesses that have been targeted by the shutdowns, specifically called out businesses that would be impacted. And I don't know how many of those are in those in those applications that we already have. So, I mean, offhand, so I would just say, let's really look at those.
Yeah, that sounds great. I mean, that was a very, I'm pointing at the screen because that's where Commissioner Starrett is, but I'm also pointing to Ken that that's very clear policy guidance around going forward with spending the money or dispersing the money to businesses. So, yeah, and I'm happy to keep it. I wanted to make sure we got this conversation started so that on December 3rd, we had a better sense of let's make a decision if we can, or, you know, my understanding is the next round of guidance around it is supposed to come out on Friday. So whatever today is, that's coming up. Yeah. But thank you, Commissioner. I'm with you on that. I think that this should, this funding should go as much as possible targeted to the businesses that are impacted from this particular freeze, because I think that's really why the money was being dispersed, is to at least try to in some way soften this blow to businesses right now. I mean, gyms are completely closed, so at least at a minimum, a restaurant is able to continue doing takeout, but for some of them, they're closed. All right, well, we will anxiously await guidance from the state, and then maybe we will continue the conversation at the very least.
Yeah, and once I get some information from the state that looks like they have an agreement and they finalize what the amounts are, I think that is going to help, even though there'll be a timing because of Thanksgiving, we're not scheduled to have a formal session next week.
Yep.
But I do recognize that if we do get an agreement, at least it'll outline some of the framework of what a program could look like, and so we can get the other, you know, processes that we need to implement moving.
And perhaps even have, I mean, and to the viewing public, that sounds crazy, but perhaps having something that we can agree to by December 3rd seems possible. And I know that sounds really slow to the rest of the world, but it is fast for government.
I would agree, because, you know, the last time we did emergency release grants in the spring, I mean, that was a pretty quick turnaround as far as where we went from announcements and getting funds released.
Yeah.
You know, that was really quick. So
we
have a template that's in place for being able to execute the, you know, this type of grant program.
Yeah.
And you can tailor make it as, you know, once we see the criteria and then the commissioners, if there's a further criteria that you want to have applied to it, then we can do that.
Right. Event venues. I just remember that's one of those other ones that's totally shut down.
Right.
Yeah. All right, great. Thank you very much. And the only other thing is a very brief, because it's actually an announcement, which is that the at LIPSIC, commissioners, were you?
I wasn't there. Yeah,
You were there. Yeah, that's right.
No,
you weren't.
Remember I sent you an email?
Yes.
Because I had my
So I had to join and then not be on the SWAC meeting, but I brought up having a further conversation about Measure 110, and there's a lot of interest in it. So rather than wait till the next LIPSIC, they're going to schedule a special meeting of Lipstick specifically to talk about this with a lot of interest from everybody. So look forward to that one. That's it for me.
Yay.
Christian?
I'm sorry, one item, and it's not soccer related, but in either on the 3rd or the 10th, I'm not sure the date off the top of my head, we're going to be impaneling the Hospital Finance Authority and taking some action on some Friendsview matters.
Yes.
We do need to replace the 2 citizen members of the Hospital Finance Authority. As we were in session, I received an email from our bond counsel reporting that Mayor of Newburgh, Rick Rogers, and Mike Goins, I hope I'm pronouncing that correctly, the retired chief financial officer of George Fox College, would be willing to serve as the 2 citizen members of the Hospital Finance Authority. We had been doing some thinking about other names that might be brought forward. Didn't have any solid candidates yet. We had reached out to the other 2 prior members, and neither of them are in their previous positions anymore, and we haven't had any luck contacting them. So I think it will be entirely likely that we will need to be replacing these 2 individuals.
Okay.
So I don't know if the board has thoughts or comments about whether or not you would be comfortable bringing forward Mayor Rogers and Mike Goins as the citizen members of the Hospital Finance Authority on either the 3rd or the 10th of December.
And then Ken had, like, I'm going to say something.
Oh,
face.
no, I'm just, no,
Okay. Well, this would be an action we would take on December 3rd, presumably.
Right, but we would need to make sure that those folks are informed and make sure they're available. And if they are the citizens that the board would feel comfortable appointing, we'll make sure that they're available and then can be in attendance, because the plan, as we had talked about it with bond counsel previously, was the first action would be to appoint them, and then we would seek the authority to take action on the Friendsview request.
Right.
I guess my only question, because admittedly, this is a board that is convened for the last time it was in 2014 or, so quite some time ago. I'm actually kind of surprised that bond counsel went kind of did a recruitment, because I don't know I don't even understand the full authority of that committee. I'll just admit that, so if the board has questions for me, I don't have answers as far as a recommendation. Yes, I think Mary, Commissioner Starrett probably knows more about the committee. It's the only one that
Right.
may be in the room here that participated. Oh, and Christian have as
okay.
well. Yes, the last time that the committee had convened.
Right.
So.
We did something very similar last time. We had previous members who were no longer available. We solicited, folks. I'm not sure exactly what the process was that we went through to identify the 2 individuals who we had appointed last time, but it wouldn't surprise me if it was similar than what we're doing.
Yeah.
What we're doing now. They were voted upon, and they became part of the authority, and then the authority took action.
Well, I'm perfectly fine with having them brought forward at December 3rd, but Commissioner Sarah, do you?
Yes, that was a long time ago. No, I think that makes sense in light of the fact that, yeah, I agree.
Okay.
I know both the gentlemen fairly well, of course, Mayor Newberg, but those the 2 people, and I know them both. I think for the functioning, what the hospital authority board really does, and how often they meet in the functioning, I'm very comfortable bringing those 2 names.
Okay.
All right, thanks. I'll let them know, and then we'll set that up to have them available on the date that we settle on. I just can't remember if it's the 3rd or the 10th.
I can't
Probably one of
actually
those
do
2
that.
days. Thank you. That's all I had.
Okay. Great. Thank you. Ken, do you have anything?
I don't. I think I've spoken up.
Yes. No, I just said yes, but Carolina? Okay. With that, I will close this meeting of the County Board of Commissioners. And I need to sign.
Actually, no, you don't have to,
Oh, okay. The CBA. Okay.
because